Chairman, we may begin. Good morning, everyone, and welcome. We are going to begin today's activity with the activity reports for the period 2018-2022 and with perspectives for the period 2022-2024. To begin, we will hear the report of the presidency by Diana Miriam Miloslavich Tupac, Minister of Women and Vulnerable Populations in Peru. We will wait a moment for her to arrive.
Bueno, hasta que llegue el...
Well, until the speaker from Peru arrives, we will move on and invite Flor Vela Hernandez from UNFPA, who will be sharing the reports. Thank you and good morning, everyone. Various members of the presiding officers of the Regional Conference on Population and Development in Latin America and the Caribbean, representatives of the diplomatic corps to Chile, representatives of civil society organizations, academics and colleagues, international cooperation of the UN system, ladies and gentlemen. During the 2018-2021 period, the UN Population Fund accompanied the countries of the region in implementing the Montevideo Consensus on Population and Development, guided by the three transformative results: putting an end to avoidable maternal deaths, putting an end to unmet family planning needs, putting an end to violence against women and girls, and other harmful practices, with the main principle leaving no one behind, as established in the 2030 Agenda. To leave no one behind in our region, UNFPA has focused its interventions on reducing inequality, promoting the rights of the most excluded population groups, especially the indigenous and Afro-descendant people, people with disability, migrants, and persons from the various sexual diversities, as well as gender diversity, and women, girls, adolescents, and young people. The impact of the COVID-19 pandemic has hindered the progress in implementing the Montevideo Consensus, the SDGs, and the three transformative results. UNFPA considers that due to the discontinuity of services and increasing poverty resulting from the crisis, approximately 20 million women were had to stop using modern contraceptive means in the region, and meant that we have returned 30 years back and added another 2 million unintentional pregnancies. A study by by PAHO said that 92% of 447 maternal deaths analyzed associated to COVID-19 were of women of indigenous and Afro-descendant descendancy. The confinement measures contributed to the rise in gender violence with a greater impact on indigenous and Afro-descendant or migrant women. UNFPA accompanied the countries of the region in response to the health crisis, promoting the continuity of services and ensuring the delivery of reproductive health devices and offsetting the physical and psychological impact of gender violence, and also helped out with frontline health workers in 18 countries of Latin America and the Caribbean. In Colombia, 9,000 women and community organizations received special menstrual and personal hygiene kits, and 171 hospitals received personal protection equipment. The pandemic has left us with a very important lesson, and that is the progress and rights, including sexual and reproductive rights of women, girls, adolescents, and young people, are not consolidated, and it is necessary to continue speeding up actions in order to avoid possible setbacks. We recognize the efforts made by countries of the region to meet their commitments within the framework of the Montevideo Consensus, and given the financial difficulties faced on account of the rising needs stemming from the pandemic and global economic crisis, among other circumstances. We reiterate the commitment of UNFPA to continue accompanying all countries of the region hand in hand with strategic partners and to achieve the commitments of the CRPD, Montevideo Consensus, the 2030 Agenda, and the three transformative results. Today, we are pleased to share the report on UNFPA activities to support the implementation of the Montevideo Consensus on Population and Development, and which we would like to highlight some of the main contributions. And from 2018 to 2021, UNFPA supported countries of region in promoting and guaranteeing the enjoyment of sexual and reproductive rights, especially for women, adolescents, and young people, including humanitarian and emergency situations.
There has been a support to the countries to achieve zero maternal death through the strengthening of regulations and through providing technical assistance. For instance, in Bolivia, it supported the health system so as to increase surveillance and help in mortal mortality, and provided technical support in neonatal and maternal health. We supported the ministries of health and also training in health in 12 countries of the region in order to strengthen the incidence capacity and improve the skills of midwives. We point out two initiatives for the reduction of maternal mortality. We have Vital Midwife in Colombia, which takes advantage of the ancestral knowledges in this area and includes new technologies, and Madres Campeonas in Dominican Republic, which brought health services to communities that had difficult access to it. The countries of the region were supported to develop evidences and innovative tools in order to strengthen the national capacities for political advocacy and incidents for decision making, family planning, and securing the inputs. In Argentina, Chile, and Uruguay, the care for pregnant adolescents have had a very important impact in the fertility rate of adolescents. Two of the main tools have been the model of laboral educational impact and also social assistance, and also in this way care to the pregnancy of adolescents to measure the opportunity costs and measure the socioeconomical results. We also have a model to estimate the attainment of goals regarding adolescent pregnancy reduction. National capacities were strengthened in 10 countries in order to estimate, acquire, distribute, and follow in an effective way the provision of inputs for reproductive health. And we supported Panama, Paraguay, and Trinidad and Tobago, amongst others, to introduce contraceptive implants, reversible, long duration, improving the systems for planning, for family planning. UNFPA helped empower adolescents and the young people. We generated evidence and we improved the access to health services, sexual and reproductive health services, quality services, and integral education regarding sexuality. Through the Juventudes Ya strategy, over 2,000 young leaders from 18 countries became defendants of the program of action of the CIPD, the Montevideo Consensus, and the 2030 Agenda. This in an alliance with PAHO and UNICEF, we developed the Intergenerational program to reduce adolescent pregnancy. This has served as a reference for national policies in Argentina, Ecuador, El Salvador, Dominican Republic, and Paraguay. We provided technical assistance to 8 countries in order to implement health services for adolescents with good quality and coverage in Panama, Cuba, and Venezuela. We also supported the health ministries in order to measure the quality and coverage of friendly services for adolescents. The UNFPA collaborated with the educational institutions of 7 countries to implement the integrated sexual education and provided technical assistance to implement the educational strategy out of schools in Paraguay, Panama, El Salvador, and Nicaragua. The UNFPA has also supported, or the UNFPA with support of the European Union through the Spotlight Initiative and the AECID contributed to put an end to gender violence and other noxious practices, including trans marriages, promoting an orderly response and a multi-sectoral response, and also given more access to essential services and also helping in the transformation of cultural and gender norms. We have supported the mechanisms for the advancement of women in 14 countries for the implementation of the essential services package in order to respond to violence against women and girls from a multi-sectoral perspective, focused in the needs of those who survive. We have strengthened, we have contributed to capacity strengthening of many public servants to provide social services to those who survive violences, and also curricula were improved in Chile, Peru, and Uruguay, amongst other countries. We developed strategies to put an end to child marriages and early unions in 7 countries with an international plan. We carried out studies in Bolivia, Honduras, and Peru in order to understand what determines child marriage and early unions, and in that way give a guidance for public policies and community work for the transformation of social norms. The UNFPA and ECLAC have provided support for population and housing censuses of 18 countries of Latin America and 9 countries of the Caribbean, in alliance with the IDB and the Organization of the Caribbean States. We developed the capacity to do censuses in times of pandemic and also to do censuses with an ethnic, color, and racial approach. We have also supported with the integration of high-resolution geospatial information in Guatemala, Haiti, and Panama. UNFPA and CELAD supported 16 national statistic offices for them to produce a subnational mapping of indicators prioritized for the implementation of programs and investments. And amongst other initiatives, they provided technical assistance to 12 countries for the projection of subnational populations in a disaggregated way by age and gender in Mexico, Chile, Peru, Colombia, and Guatemala. The Converge initiative opened opportunities to review the current challenges of the civil registries and the vital statistics systems and improve access to vital statistical data. UNFPA worked with governments and local partners to guarantee the continuity of the sexual and reproductive health services that save lives and the response to gender violence in humanitarian areas. These efforts helped women and girls affected by the socioeconomic crisis in Venezuela and in other places in Central, and due to problems in Central America and the earthquake in Haiti, guaranteeing access to sexual and reproductive health services, and also regarding violence, and providing safe spaces for displaced migrant women and those who are in a vulnerable condition. UNFPA between 2020 and 2021 implemented its first strategy, its first regional strategy to leave no one behind, developing an outstanding program for Afro-descendant persons, for indigenous peoples, and for disabled persons, with 3 lines of action: visibility, inclusion, and participation. The UNFPA and ECLAC collaborated to improve statistics and generation of evidence in the inclusion of self-identification variables, ethnical and racial, and questions from the Washington Group for Censuses for Vital Statistics, where there was research regarding the urgent challenges that we have to face to eliminate all the forms of discrimination with regional and ethnical aspects, and also the fight against inequality in Latin America and statistical visibility of the indigenous peoples in Latin America. In the area of participation, we empowered women, adolescents, and young people through the Leadership Juvenile School for Afro-descendants of Latin America and the Caribbean, in alliance with Peru. 200 young persons from 18 countries of the region graduated from the courses, thus strengthening the force of women and young people for the intergenerational promotion of sexual and reproductive rights in alliance with a group of indigenous women of Latin America, and an online course on leadership and empowerment of women, adolescents and young peoples with disabilities or Afro-descendants, in alliance with the Latin American Network for Disabled Persons and the support of the Spanish cooperation through the program We Decide. If we take into account alliances, platforms, and regional networks and organizations of the civil society, of women and young people, academicians, and members of parliament like Par Latino and the Afro-Descendant Parliamentarian Group to promote and defend the rights of Afro-descendants and indigenous peoples. I would like to conclude these remarks by looking into the future. In the coming year, the UNFPA will continue to focus its works in the attainment of the three transformative results. But UNFPA cannot do it alone. We will strengthen the strategic alliances to guarantee the principle of nothing without us. Until then, we continue to work in order to contribute to a world where each pregnancy should be a desired pregnancy, deliveries should be safe, and every young person should be able to develop their full potential. Thank you very much.
We thank Flor Bella Fernandez, Assistant Deputy Regional Director of UNFPA for Latin America and the Caribbean. Now I'll invite Julio Cesar Vargas, Minister of Public Health and Social Wellbeing of Paraguay. He is president of the Intergovernmental Regional Conference and will present a report on the conference on aging and of older people in Latin America and the Caribbean. Good morning, everyone. Mr. Mario Timoli, Mr. Harold Robinson, Regional Director for Latin America and the Caribbean of UNFPA, Mr. Luis Yanez, Secretary of ECLAC Commission, Mr. Simon Cettine, Director of CELADE, distinguished delegates of the member states and associated states of ECLAC, ladies and gentlemen. I bring cordial greetings from the government of Paraguay. It's an honor to participate in the regional conference, in this fourth regional conference on population and development of Latin America and the Caribbean. I will now tell you what has been our work on aging and rights of elderly people. There are some good sound data I would like to share with you as a result of the fourth Intergovernmental Regional Conference organized in Asunción from 27-30 June of 2017. Asunción Declaration was adopted, building inclusive societies in rights, and it exhorts governments to have plans and development plans, the aging subject, and start specific measures bearing in mind the 2030 Sustainable Agenda and the Montevideo Consensus, among others. In that sense, and to move on in the compliance of the declaration, the chair, jointly with the Technical Secretariat on Aging, has conducted several activities that are detailed now. In 2019, the Technical Secretariat organized, with the support of this chair, 3 meetings in the context of the Regional Intergovernmental Conference. The first one was the Forum of Multi-Sectoral Advocacy, organized by the Social Welfare Ministry. In the same year, the Forum on Policies for Human Resources, organized by the Ministry of Public Health and with the support of Korea, and experts from Korea, Argentina, and Chile, and CELADE from ECLAC. Finally, the International Seminar on Population Aging and Public Policies linked to the elderly population, which was a space of reflection on the economic and social impact of demographic changes and public policies linked to elderly people. It convened governmental agents, civil society, academia, and defined actions in favor of elderly people, and it was organized by the Ministry of Public Health and Social Welfare and CELADE. In 2020, the virtual dialogue on challenges for the protection of elderly persons and their rights vis-a-vis the pandemic of COVID-19. An instance of reflection addressing decision makers jointly with academia and organizations of civil society in order to analyze the socio-demographic scenario of the countries of the region and the health crisis and the impact on elderly population. That same year, nationally, we had a virtual seminar on a decade for healthy aging, organized by the Ministry of Public Health with PAHO, WHO, with the purpose of creating awareness about the strategy and identify potential intersectoral alliances to develop actions in terms of healthy aging. In 2021, in the region, we organized the 4th evaluation and 5-year examination of the International Action Plan of Madrid that will be held in 2023 in the 61st session of the Social Development Session of the UN. And this year, in 2022, it will be held in the 5th meeting of the Regional Intergovernmental Conference on the Aging and Rights of Older People in Latin America and the Caribbean. The 4th 5-year review provides us with an excellent opportunity to assess the progress achieved in the last years in the region on the priority defined areas: older people and development, promotion of health, and favorable environments. Thus, the idea is to see the compliance of regional agreements on the subjects like Declaration of Brasilia, where you have the letter of San Jose on persons of old age, the Consensus of Montevideo on Population and Development 2013, the Inter-American Convention on the Protection of Human Rights of Older People of 2015, and the Asunción Declaration 2017, as well as the 2030 Agenda for Sustainable Development, with the purpose of supporting Latin American countries and Caribbean in the preparation of their corresponding national reports. ECLAC, as Technical Secretariat of the Intergovernmental Regional Conference on Aging and Rights of elderly people of Latin America and the Caribbean, prepared a guide for preparing reports, country reports, to be submitted at Madrid, with this provided some methodological guidelines and content as well. The information provided by governments through the guide constitute the basis for the preparation of the regional report that ECLAC will present in the regional and world instances in the fourth cycle of review and evaluation. The technical secretariat of the conference, jointly with this chair, invited member states for creating awareness of the guideline about the implementation of the International Action Plan in Madrid on aging that was held in August 20th, 2021. That meeting gave rise to the process of preparing country reports. And one of the main recommendations for the country reports was to ensure the participation of different governmental institutions involved in policies regarding elderly people, as well as representatives of the civil society. And with this purpose, a meeting was done with organization of civil society, where there was a report on the preparation of national reports. Since September 2021, the Technical Secretariat of ECLAC has provided technical assistance to 19 countries of the region that have requested it for the preparation of national reports in order to conduct the examination and evaluation at national levels. In this context, it has promoted the creation of interinstitutional networks, strengthening the links among government agencies like OSSC, universities, research centers, and professional associations, therefore strengthening public and social actions in policies and influence on participation of older people. In November 2021, the preparatory meeting of the 5th Intergovernmental Conference on Aging and Rights of Older People in Latin America and the Caribbean, that had as purpose to present a content proposal for the preparation of the regional report and experiences on compliance of the International Action Plan of Madrid, and to consider the results of and delegates of countries, representatives of 18 governments in the region, 12 Latin America and 6 of the Caribbean, presented progress and experiences in the process of preparing national reports in the 4th examination and evaluation of the International Action Plan of Madrid on aging. All these activities enabled strengthening the technical capacity of countries regarding the challenge involved in the population change for the implementation of the 2030 Agenda, reinforce collaborative work and exchange of views among different organizations, and strengthen their protagonism in the 2030 Agenda. Expand the participation of the elderly in the examinations and proposals so as to improve their situation and exercise human rights. We need to continue strengthening collaborative and coordinated work because older populations need it, deserve it, and cannot be left behind. Finally, I would like to close my report inviting you to participate in the 5th International Intergovernmental Conference on Aging and Rights of Human Rights that will be in December 15th, 2022 in ECLAC, Santiago. And this coincides with two events. First, the beginning of the decade of the UN for healthy aging, 2021-2030, and marks 10 years of collaboration in the sector to improve the lives of older people, their families, and communities. And secondly, it's the commemoration of the anniversary of the second conference and the fourth MIPA. All these landmarks provide an opportunity to drive international action and thus move forward in the agenda of aging. I would like to express our acknowledgement to CELADE, Division of Population of ECLAC, as Technical Secretariat of the conference, for the support, collaboration, and accompaniment permanently provided to us throughout these 5 years of work, as well as to the Population Fund of the United Nations, without whose enthusiastic support it would have been much more difficult to accomplish all these tasks. We want to thank all the other organizations that have provided support in different areas. To all of you, thank you very much.
We thank Mr. Borba of Paraguay in his capacity as the chair for the presentation of the report on the International Interregional Conference on Aging and Rights of Older People from Latin America and the Caribbean. Now we're giving the floor to the report of the chair by Diana Miriam Milosevic, Minister of Women and Vulnerable Populations of Peru. Mr. David Watava, the Vice Minister of Planning and Chair of this conference. Madam Flor Bella Fernandez, Deputy Director for Latin America and the Caribbean of the United Nations Fund for Population Activities, Mr. David Gustama, Mr. Luis Yañez, Mr. Simón Sequin, Director of CELADE, distinguished delegates of state members and associated of ECLAC, ladies and gentlemen, participants from civil society organization. It's with a great honor for the government of Peru through the Government of Women and Vulnerable Population to present the report of activities held in these 4 years from after the holding of the fourth meeting of the Regional Conference on Population and Development held in Lima in August 2018. At the time of presenting the task carried out by the chair, there are many principles that we want to share with you. Among the first outcomes of the meeting, the conference received the project of the third regional report on the implementation of the Montevideo Consensus prepared by the Technical Secretariat with the support of UNFPA, which subsequently, after becoming the first regional report, was presented by our chair in the 52 period of session of the Conference of Population and Development held in April 2018 in New York, as the contribution of the region to the review and world evaluation of the execution of the action plan of the International Conference on Population and Development after 2014. After that, in the third meeting of the Forum of Latin American and Caribbean countries on sustainable development, held the same month in Santiago de Chile, was also presented. Another important milestone was the presentation of 25 voluntary national report on the implementation of the Montevideo Consensus. 15 countries from Latin America and 10 countries of Caribbean, at a show of the deep commitment of the region with putting in place the consensus. In July 2018, the Technical Secretariat, with the support of UNFPA, Presidency, and the Government of Mexico, in their capacity of coordinator of the work group of the indicators and the follow-up of the indicator of Montevideo, we held a meeting in Panama in July to present the outcomes of activities carried out in the definition of pending metadata of indicators. The fourth meeting of the chair of the regional conference held in October the same year here at ICLAC was the final opportunity that we have to meet face to face. Among other agreements, we extended for an undetermined time the validity of the indicators work group as a space for exchange of information and cooperation among countries regarding the construction of indicators for the follow-up of Montevideo consensus. Likewise, this chair received the commission with the UNFPA and Technical Secretariat to present a proposal for calendar for submitting reports and the regional reports on the implementation of a consensus that should be compatible with the review and global evaluation on the execution of the action plan after 2014 and the follow-up of the implementation of Agenda 2030 for Sustainable Development. This proposal is condensed in the work papers of this fourth meeting of today. In 2020, given the situation of the pandemics, the chair, the presiding officer, decided to postpone the fourth meeting of the regional conference that should be held in October 2020 and requested this chair that with support of the Technical Secretariat and the UNFPA, they would organize 5 thematic virtual dialogues analyzing the socio-demographic scenario of the countries in the framework of the COVID-19 crisis and potential impact, considering prioritary measures of the Montevideo Consensus and the Agenda 2030. The dialogues were a very fruitful instant for exchanging information, experiences, and learning around the main issues and challenges presented to governments were facing to mitigate the crisis, especially to serve the most vulnerable groups of population and for sharing initiative and best practices and to promoting cooperation mechanisms among countries that needed coordinated responses to deal with COVID-19 crisis. Among the topics were impacts of pandemic on migrant people, Afro-descendant people, persons with population and sexual and reproductive rights and Caribbean population. The institution of the regional conference, which calendar has been altered due to the pandemics. In May 2021, we held the virtual executive meeting of the presiding officers. The chair presented a report on virtual dialogue held between August and December 2020. Among the main agreements, we highlight the decision from countries to hold the fourth meeting on population and development on the first semester of 2022 at ICLAC in Santiago in a hybrid modality, both face-to-face and virtual. And today we are fulfilling this mandate and we are extremely proud and satisfied about that. The chair ended its period that was extended due to the sanitary crisis with the satisfaction of fulfilled duty. in Peru, through the Ministry of the Women and Vulnerable Population, we want to thank all member countries of the presiding officers and the conference for their support and their commitment with the effort to move forward on the implementation of the Montevideo Consensus. Without any doubt, we have had very fruitful but with a lot of problems with the main challenge of the pandemics. We need to work at our maximum and our capacities and creativity to look for institutional mechanisms that will allow us to continue to work and continue to contribute with alternatives and proposals to deal with the devastating sanitary crisis that affected our region. I want also to express our acknowledgement and recognition to CELADE, Population Division of ICLAC, in the role of Technical Secretariat of the conference, for their support, collaboration provided to us permanently all through these 4 years of work. Same goes for the United Nations Fund for Population Activity. Without their support, resistance, it would have been very difficult to carry out most of the tasks that we completed. We have worked in unison, and this has been reflected in the results achieved. We are very close to a significant milestone, 10 years of the Montevideo Consensus in matters of population and development. In Peru, we will add our efforts and collaboration along with the rest of Latin American and Caribbean countries to celebrate this milestone, or that is a motive of pride for our region. It will be another occasion to renew the commitment of all of us with the implementation of the Montevideo Consensus, and specifically with the great challenges that we have ahead of us to fulfill the consensus in this new environment. We reiterate our salutations and well wishes to the new chair, and we wish the government of Bolivia the greatest of successes in the period they are beginning, in order to continue to work in the progress of this region in implementing the Montevideo Consensus and to address this new pandemic wave, among others. You have the full support, collaboration, and experience of the government of Peru to embrace this challenging and urgent task, and hoping that vulnerable population and women will not still be letting behind in the main challenges that we have as a region. We thank the Minister Diana Miloslavich, who presented the report of the chair, a chair that has to face innumerable challenges in the framework of the COVID-19 pandemics. We want to invite Zulma Sosa, coordinator of the CELADE Population and Development Area, who will present the report of the Secretariat. Thank you, Mr. President. Good morning to all of you. It's a pleasure to be here with you in this significant event that we all were waiting for. A very nice salutation to the authorities that accompany me here in the chair, and all those participants, both face-to-face and virtual. I have been requested to share a summary of our task in these 4 years from the Secretariat of the conference. And in this respect, I want to use a presentation. My colleagues maybe can put it essentially in terms of the axis that guide CELADE's action. The CEPAL population division is 4-year. Our activities were guided by the work program of ECLAC system, which is population development, with the main purpose of fully integrate the population topics in the planning policies and program and development programs of the countries. Achieving this strategic objective has been possible thanks to the permanent collaboration provided by other agencies of the United Nations, particularly the UNFPA. In this sense, actions that guide our work are mainly structured along 3 axes, what are national requests, regional affairs, most specifically the acute social, economic, ethnic, and gender inequality, and of course, the different international agreements that made up the compass of our actions. And from the holding, starting in the holding of the 3rd Regional Conference on Population and Development that was reported by the chair, that was held in Lima in 2018, ECLAC and CELADE has provided technical support to the countries of the region for the fulfillment of the agreement, specifically to the government of Peru in its capacity as chair of the regional conference. Without the will to, I won't repeat the activities that has been detailed by Madam the Minister of Peru. I want to reinforce that in the framework of the 4th Regional Conference on Population and Development, we received the first project for the implementation of the Montevideo Consensus prepared by the Technical Secretariat with the support of UNPA, based on national reports and analysis of the state of population and development in the region, among other sources. And Madam the Minister said this report was presented in the 52 period of session of the Population and Development Commission of the United Nations as the contribution of Latin America and the Caribbean to the global review on the execution of the World Population and Development Conference after 2014. It was also stated that the meeting of the work group on indicators was held in Panama, led by Mexico. In terms of the activities during the pandemics, particularly that were mentioned, we highlight the virtual dialogue and the series of 5 theme reports on the effect of pandemics
on specific population groups, and likewise the celebration of the executive session of presiding officers held in May 2021. And then, with regard to the strengthening of the capacity of peoples to carry out the 2020 round of censuses, this gained particular relevance for the policies for economic and social recovery after the health crisis, which affected the census schedules of the countries of Latin America and imposed major instrumental challenges to measure the progress made in achieving these goals and the targets of the development agenda, in a situation where there were already many other existing challenges. CELADE has worked intensely at a distance as well as with missions to countries. And as of 2020, however, there was a turning point with regard to the strategies and the technical assistance stemming from the health restrictions and also restrictions to mobility. Although we must highlight the very quick adaptation to virtuality and that allowed the preparation of censuses to not stop. Unfortunately, the pandemic did mean that the collection of data had to be postponed. And so the technical assistance provided by CELADE was comprehensive with regard to almost all technical processes of the census, such as preparation, collection, assessment, among others, and even took part in high level meetings to support decisions about particular key milestones. We should mention that the entire work was carried out in close coordination with UNFPA. And likewise, there have been several or seminars and working seminars to exchange experiences among countries of the region and promoted South-South cooperation either online or in person. And so we highlight the seminar on conceptual aspects of population and housing censuses, challenges in the definition of content in the 2020 census round. And then, with regard to the Caribbean, also work has been very active by means of direct collaboration with the sub-regional ECLAC office in the Caribbean. And these are available online through technical assistance, the different applications with the Red Data web server platforms for the last census on Antigua and Barbuda, St. Vincent and the Grenadines, Montserrat, St. Kitts and Nevis, and Aruba. With regard to the production of substantive documents, there's also been a varied output, and these, of course, help disseminate knowledge and best practices in different census matters, highlighting, for example, publications by the 2021 Observatory on recommendations for population and housing censuses in Latin America, Revision 2020. In the context also of constant support provided by CELADE to region member countries and other parts of the world is the continuous development of the Red Data software, which is a data recovery for small areas using microcomputers, each day more updated to accompany census processes quite aside from the traditional approach has to do with the dissemination of microdata, censuses, and statistics. So red data is currently being used with success in the data processing analysis stages of the pilots and the experimental censuses with a view to improve the quality of the information. In this regard, during this period, the new generation called Red Data Plus, in line with the technological changes that have occurred to provide multi-platform support to processors used in different countries. And with the support of German cooperation, CELADE is also developing Odyssey, which allows online processing of census data available on daily mobility, domestic migration, and residences, among other. And so we should highlight the strengthening of national capacities for the use of our data and social demographic data with a very hard task throughout this period, when about 15 training red data activities were carried out for the national statistics offices and other country organizations. And then, with regard to estimates and population forecasts, as you know, CELADE, since its creation in 1957, has worked with the countries of Latin America, drafting estimates and population projections and sharing the work with the population division of the UN. And during this period, technical advice has been given to several countries throughout the process to devise estimates and the assessment of basic information, applying demographic techniques, applying methods for projections, among others. And CELADE also has maintained active participation in international working groups on these matters, and likewise, during the period considered, estimates and projections for population were revised by sex and age groups for countries of Latin America. The figures were published in the database as well as the demographic trends in the 2019 version of the Demographic Observatory, and also progress was made in joint work with the Population Division of the UN in order to update the estimated figures 1950 through 2020 by simple ages and calendar year, including the pandemic of the COVID-19 pandemic on fertility and birth rates and others. And all of this is available on the CELADE website. And then, with regard to the subject of young people, sexual and reproductive health, institutional work in this area continued quite active despite the limitations imposed by the pandemic. In terms of technical assistance, countries were supported to do studies on adolescent fertility as well as measuring the 3.72 indicator of SDGs, and also with regard to data banks. These were updated and Maternal to include the standards of the new ECLAC website, which has allowed extending the material available to be able to see the data. And also studies have been carried out in several countries of the region. And then, with regard to the demographic changes and challenges for development, the countries of the region have faced the challenge of being able to assess the opportunities and challenges posed by demographic transition. In this context, CELADE implemented during 2017 and 2019 the project of the UN Account for Development, Demographic Transition, Opportunities and Challenges to achieve the SDGs in Latin America and the Caribbean, and this allowed to strengthen technical capacities in 11 beneficiary countries. In this case, these countries advanced in the production of the so-called national transfer accounts and national time transfer accounts, tools very useful to capture intergenerational flows in economies. And also, the national studies were carried out and technical assistance was provided at national as well as regional level. And one very fruitful output has been an updated version in Spanish of the national transfer accounts, measurement and analysis of the generational economy in collaboration with the population division of the UN, and which represents a very important tool to study, interpret, and comprehend more fully the demographic changes and the macroeconomic and distributary effects. Several countries are considering integrating these accounts to their national statistic systems. And I would like to also highlight the work by DANE in Colombia that has officially included the methodology of the national transfer accounts to their national statistics plan in Colombia. And then, with regard to aging, already part of these were mentioned by the chair of the conference, Paraguay, and I would merely like to highlight some of these, such as those that we are carrying out within the framework of following up on the regional conference on aging and the rights of older persons, and which is in turn very linked to Chapter 6 of the Montevideo Consensus on Population and Development that deals precisely with aging, social protection, and socioeconomic challenges. And in this sense, one of the major works that we have been carrying out is precisely, or is framed within the fourth examining and 5-year review of the implementation of the Action Plan of Madrid to be carried worldwide in 2023 within the framework of the 61st period of sessions of the ECOSOC. And the regional examination will be conducted this year, as was just mentioned by Minister Borba of Paraguay, within the framework of the 5th Regional Intergovernmental Conference on Aging and the Rights of Older Persons in Chile. And in this sense, CELADE has provided technical assistance to countries to draft their respective national reports. Specifically, 18 countries have received this collaboration, and 15 national reports have been received, which will be the grounds for the regional report. And likewise, the preparatory meeting for the 5th conference was carried out with a major participation by delegates from governments as well as the civil society. And also in CELADE, we take actively part in the interagency groups, both for the follow-up of the Madrid Action Plan, as well as the Decade of Healthy Aging led by the WHO PAHO. And likewise, we have taken part in a series of seminars and workshops within the framework of the UN 10 years on aging, organized by PAHO and ECLAC. And there too, there's a number or a varied number of publications on aging and the rights of older persons. And then with regard to international migration, human rights and development, the Secretariat has done regional coordination tasks with the network of UN on migration, together with the International Organization for Migration. And later on, we will be hearing Director Marcelo Bisani, who will be sharing further information on these activities. All of these activities within the framework of the UN Network on Migration have been carried out to address the follow-up of the implementation of the World Compact for Safe Migration. Likewise, since 2021, ECLAC is part of the coordination of the thematic coalition on human mobility within the framework of the Platform for Regional Cooperation for Latin America and the Caribbean, together with other UN agencies. ECLAC and the IOM, within the mandate of the General Assembly, held a meeting for the review of the World Compact for safe, regular, and orderly migration in Latin America and the Caribbean, and the results of which are also available. Among others, we highlight 2 documents within the area of regional review: the report of the meeting prepared by ECLAC and the regional report of the review, also available at the ECLAC website as well as the IOM. Likewise, within the framework of the draft on the compiling and use of international data that we coordinate with the UN Statistics Division, we've drafted a regional report based on the consolidation of 10 national reports on the assessment of the national capacity to produce data on international migration, as well as a roadmap to strengthen the capacities to produce data on international migration. And in addition, since 2020, CELADE has carried out the project for contribution to interregional migration and the contributions to economic growth. And last year, 4 studies were carried out in Chile, as well as Costa Rica, Mexico, and Peru, on quantitative and qualitative contributions by migration to sustainable development, and that resulted in the publication today, also available on the ECLAC website. As to internal migration, spatial distribution of the population, in recent decades, CELADE has examined the phenomenon and process and described it in detail. With a regional approach, the studies carried out have showed interrelations with development processes at national and subnational level. These themes are also framed in Chapter G of the Montevideo Consensus on Population and Development on Territorial Inequality, Spatial Mobility, and Vulnerability, and also related to other international agreements, highlighting especially the 2030 Agenda and the new urban agenda within the Sendai framework for the reduction of the risk of disaster 2015-2030. Within the framework of this, many activities were carried out, technical assistance linked to the theme, and likewise, updated statistical information has been provided on the trends and patterns of migration within the countries of the region. And so likewise, regular updates have been done of the databases on internal migration and spatial distribution of the population and urbanization de Pualc, and also supported the Odisea platform, and several documents have been published in the Population and Development series of ECLAC. As to the matter of indigenous people and Afro-descendants, inclusion of the specific chapters related to this within the Montevideo Consensus undoubtedly shows the commitment of states to close the gaps between the implementation of measures to ensure the rights of these collectives in their daily life.
In this framework, CELADE has continued with a series of actions to contribute to the advancement of the different agreements in different areas, inclusion of Afro-descendant populations and indigenous people, the preparation of studies on living conditions according to their rights, and recommendations regarding policies and capacity strengthening at a national level for the use and analysis of the information and political incidents, as well as a series of seminars, technical meetings were carried out for knowledge exchange to disseminate the information, and all these activities were carried out together with other agencies of the United Nations system, UNFPA, PAHO, and the Fund for the Development of Indigenous Peoples of Latin America, FILAC. And also we have the support of agencies like the Ford Foundation. Regarding the production of information and updated knowledge, we prepared a series of research about indigenous peoples and Afro-descendant with policy recommendations. Now, regarding persons with disabilities, CELADE also carried out a series of activities related with disabled persons and their human rights, following the mandates of the regional conference, together with the Convention of the Rights of Persons with Disability, the strategy of the United Nations to include disability, and the inclusion strategy 2021-2025 from ECLA. We have provided technical assistance to the group of Buenos Aires with statistics on disability, and also we have provided technical assistance regarding the measurement of the capacities of disability in the census and also in the production of documents. Now, regarding the training of human resources for population and development, this is also one of the main and historic lines of work of CELADE. Listening to the requests of the countries of Latin America and the Caribbean, and taking into account the new technological possibilities provided by our world today, since 2018, CELADE has offered a course for sustainable development with a combined modality where we have online training and in-person training. In March 2020, nevertheless, we had the first cases of COVID in the region, so that imposed a series of restrictions like mobility restrictions, and this required us to work with e-learning. And we have carried out the 2020-2021 version implementation. And right now we are implementing this year's version. Now, to conclude, I would just like to point out some hallmarks of some key milestones in the work that we have carried out in the last few years. We should mention that we have a historical and extensive collaboration between CELADE and the Population Division of ECLAC and UNFPA in the preparation of annual work plans. Likewise, we have joint organization activities with various partners, like the ones I have mentioned before, policy recommendations with empirical basis, and participation in institutional studies with other divisions of ECLAC, and especially the relationship with the countries of the region that has been strengthened through technical assistance. Which are some of the outlooks for the 2022-2024 period? Of course, we will continue with activities as Technical Secretariat of the Regional Conference, and we have there the organization of the 5th meeting of the presiding officers for next year, the commemoration of the 10th anniversary of adoption of the Montevideo Consensus on Population and Development 2023, follow-up of implementation of the Montevideo Consensus, update to virtual platform for follow-up of the Montevideo Consensus, and the organization of the 5th region of the Regional Conference on Population and Development for 2024. We will provide ongoing support to countries of the region in relation with the 2020 census round, as well as on other subjects, updating of data banks, development and updates of real-time software, population estimates and projections, and training activities. Also, the implementation of the Madrid International Plan of Action on Aging and the organization of the 5th Regional Intergovernmental Conference on Aging and the Rights of Older Peoples from 13 to 15 of December of this year. And of course, also, we will continue to support countries in the implementation of the Global Compact for Safe, Orderly, and Regular Migration together with IOM and the United Nations system bodies. Support to processes to mainstream the ethnic and racial approach in the 2020 censuses round and in other data sources, and production of up-to-date knowledge with policy recommendations. Thank you very much for listening, and I'll be here for any questions or clarifications that you might need. Thank you. We thank the presentation of the report by the Secretariat prepared by CELADE, Population Division of ECLAC. Now we will listen to the report on the forum with Mr. Pisani from the International Organization for Migration regarding South America. Good morning. I would like to greet very cordially the distinguished members of the main panel. I would like to greet the representatives of the countries, of the civil society, colleagues from the United Nations. I would like to thank ENCLA, UNFPA, and the chair of this conference for this possibility of presenting the report on the exam for a forum on migration. The World Compact for Safe, Regular orderly migration approved by the resolution 73/195 of the General Assembly of the United Nations. This was negotiated at an intergovernmental level with a unique approach to manage international migration. This is based on the understanding that no government can manage migration on its own without cooperation. We need bilateral, regional, or world cooperation for this purpose to fully take advantage of the potential of human mobility or protecting persons from the worst aspects of migration. The World Compact for Migration defines 23 objectives that encompass all the aspects regarding migration and that propose a series of possible actions that the states can decide to incorporate to apply in their national migration policies. Even though they are not legally binding, the principles, the goals, and the actions of the World Compact for Migration are based on obligations and principles that in turn are based on the Declaration of Human Rights, the 2030 Agenda, and international law. For the implementation of the compact, we created the UN Network on Migration that has been established to guarantee an efficient, timely, and coordinated support from all the United Nations system to the countries to implement the compact. Also, in our region, we have a network that is headed by CELADE, ECLAC, IOM, and formed by 21 agencies of the system. Additionally, we have the national networks of the United Nations on migration that operate in the framework of the United Nations of the different countries. Amongst their multiple activities, they have to create and promote the design of a plan for the application of the World Compact, the Global Compact. This resolution also defined that every full period of sessions of the General Assembly, we will have the forum to review international migration, FEMI. It was held last year in New York, and the result was a declaration on progress, pointing out the main advancements. It also points out gaps in the implementation of priorities for future work. FEMI had the participation of over 150 member states, 300 interested parties. 30 delegations came from Latin American and Caribbean countries, 21 from Central America, North America, and the Caribbean, and 9 from South America. FEMI becomes the first intergovernmental world platform for the member states to review their targets and for them to discuss their progress, making a balance regarding the implementation of the Global Compact and collectively identifying the priorities for future implementation. Also, the forum created a positive climate for the next year, strengthening multilateralism and revitalizing the commitment with the Compact. Likewise, this resolution includes regional reviews of progress every 4 years, the first of which was held in the region of Latin America and the Caribbean in April 2021, headed by ECLAC and OIM, with support from the United Nations funds and others that form the regional network. For this purpose, we developed in the region a process to support to help create the definitions in the different countries. I would like to point out the voluntary national reports that were submitted. 12 countries gave voluntary reports, submitted voluntary reports. 66 good practices, and we formulated 26 commitments that basically correspond to the governments, but we also include one from the United Nations network on migration to Latin America and the Caribbean. We also have a permanent dialogue system for the civil society with over 120 representatives of the civil society and interested parties.
Also, as a result of this work, today we have in the region 9 precursor countries and 16 national networks have been established. The support of the UN Network on Migration was fully recognized by member states, like the role that in the future will continue to fulfill in the implementation of the pact at national, regional, world level. The main regional consultation processes on migration, like the Regional Conference on Migration, CRM, the South American Conference on Migration, CSM, and the RIAM organized position meetings and issued declarations and communications regarding FEM. In debates during FEMI, experiences and tools were presented that could be shared by the region, and the following are to be highlighted. Regularization and their relevance as the first step for access to rights. Good practices is precarious residence certificate, regularizing children without documents of origin, special statute for Venezuelans, socioeconomic integration, and experiences were pointed out like workshops for entrepreneurs, recognition of certificates, national integral plans, and access to services, health, mainly in the context of the pandemic, disregarding the status of migration. The idea is to have flexibilization and simplification of those certificates, combating human trafficking, the development of national plans, protocol of early detection and trainings, the reduction of vulnerabilities with emphasis in protection of childhood, documentation as key tool for access to rights, return and reintegration policies in programs for decent and assisted voluntary return, training mechanisms, recognition of certificates and other documents, fight against discrimination, racism, and xenophobia. Exclusion is a scenario that attempts against integration and full respect of the rights of migrant peoples. The approval of the Progress Declaration of the General Assembly is designed for action, requests the Secretary General of the UN to create indicators based on SDGs in order to help the states measuring progress in the implementation of the pact. Among the challenges identified in our region, we can find the following. Establish regular meetings with participating countries of FEMI in order to monitor World Pact. Organize meetings with the members of dialogue civil society so as to identify actions for follow-up. Promote spaces of multiplayer stakeholders to discuss priorities at regional level. Prepare the new regional round 2024. Need to learn lessons from 2020, 2021, especially those roundtables in Latin America and the Caribbean. Reinforce national capacities for the implementation of the World Pact. Consolidate the role of the national networks of the UN on migration in countries of the region. Follow up all commitments that have been signed in the region, promote new ones by governments and civil society. Finally, from the regional network of the UN for migration, we want to confirm our working commitment. FEMI shows that we have moved forward significantly, but still there is a lot to do. Thank you. We thank the presentation of the report And now we invite Ana Cristina Vera Sanchez, Surcuna Alliance for Human Rights, on behalf of civil society, and she will present the results of the preparatory meeting.
Buenos días a todas, todes, todos.
Good morning, everyone. I thank my colleagues of civil society the possibility of reading our manifest as an act of rejection, symbolic rejection of what is happening in Ecuador. Feminist organizations and women movements, human rights defenders, activists, in the forum of civil society within the 4th Regional Conference from 28 to 30 of June in Santiago, we recall the states of the region that committed to the implementation of priority measures of the Montevideo Consensus as a roadmap in order to see to the problems of population and development. However, the Montevideo Consensus, considered as the most progressive intergovernmental agreement, is staying backwards in its implementation and agreements before the pandemic. In 2023, there will be 10 years since the agreement. It is urgent for the states to adopt clear, specific measures with sufficient economic resources in order to guarantee that which was committed, especially sexual and reproductive rights, with a gender approach, ethnic, racial, and accessible for all persons with disabilities, assuming them as universal human rights. In 2020, the health emergency was declared in the region, and governments had different answers to face the serious situation, where allocation of human and economic resources was not enough, nor the design or implementation of political plans and policies. And this particularly affected those historically marginalized, Afro-descending women, girls, adolescents, youth, pregnant women, diverse groups, HIV/AIDS, lesbians, migrants, travestis, women inhabiting streets, and of displacement that live in border areas, victims of trafficking and requesting refuge, among others. They are the ones that suffer the most the consequences of the gaps of inequality and poverty that lagged since before the pandemic and were exacerbated only in the health emergency. Likewise, differential access was evidenced, access to vaccines related to the market. Likewise, we alert that these certificates could exclude millions of migrant people or displaced. During the last year, 64% of countries of Latin America and the Caribbean declared interruptions in the health services of family planning, contraception, prevention services, and response, and in the safe abortion and care post-abortion services. We have evidenced that there has been an increase of maternal mortality related to pregnancies of adolescents and deliveries in girls below 15th. Also increased forced unions. Therefore, we can say that still there are barriers for the exercise of the right to autonomy and sexual freedom in Latin America and the Caribbean. In the region in 2021, 13.8% of the population would be in extreme poverty, going behind and setting back. Our labor and economic subsistence opportunities have been affected, increasing unemployment, precariousness, affecting young people, the growth of informality, the lack of timely response by states, closing of spaces for dialogue, invisibilization and precariousness of domestic work has been made invisible. The work of Afro-descending women, indigenous women, rural women, their work has made invisible. We have maintained the economy of the region with 3 shift working day. The restrictive measures, confinement measures of COVID-19, the LGBTQ plus girls with HIV were exposed to violence inside the home, psychological and sexual violence, without the possibility of being cared for, and increasing the probability of non-intentional pregnancies, and gender restrictions to go out to the streets during confinement affected trans people, exposing them to violence and discrimination. It ended in physical aggressions. The disappearances of girls and young and feminicides increased, and even discovering common areas with murdered women, as in El Salvador. There is negligence in budgetary allocations, and prioritizing privileged groups instead of vulnerable groups, especially women, adolescents, and young, indigenous and Afro-descending, to the detriment of integral health and education. Greater economic resources were allocated for curfew and militarization of some cities. Social process and activists, and as it was the case in Ecuador, Brazil, and Colombia, the arbitrary closing of borders, criminalization of civil society, detention of persons, restrictions to freedom of speech, with alarming levels of impunity in public agencies, even in the judiciary, as pointed out by feminist groups and women from Central America. Resources for mainstreaming of gender were withdrawn. Scientific education, healthcare, fight against violence based on gender, as well as for social security and spending, without ensuring basic income for those who lost employment, or those that from informal work did not have compensation. Domestic workers, street sellers, and because of isolation of COVID-19, their income went down and they lost their livelihood, completely at a loss. The advance of groups, anti-rights, religious, ultra-conservative groups in the region that ignore and breach the identity of states has favored a climate of retrocession in human rights, especially of sexual and reproductive rights, as it is the case of Brazil and Central America. They have come to occupy positions in the executive, legislative, and judicial powers. These groups have used false arguments to promote the repeal or modification of norms that embrace human rights, recognition of rights for the introduction of custody or shared care of boys, girls, ethnic or racial discrimination, those with HIV, and in projects in promoting human rights. In this regressive and punitive framework, vulnerability of women has been affected with increase of deprivation of freedom, sometimes with children in situations of violence, in micro-narco selling, those detained because of obstetric emergencies. We are concerned about the girls that are displaced, who are in transit countries. We especially emphasize the Central American Venezuelan migrants, indigenous, Afro-descending, who are violated in migration processes, and they are potential victims of trafficking, forceful disappearance, results of femicides.
In Latin America and the Caribbean, millions of people are displaced because of lack of dignified work or conflicts derived by dictatorial authoritarian regimes imposing extractivist economy, particularly in indigenous and defendant territories. Similarly, we call the attention on discrimination and stigmata experienced by children, women, and LGTB population displaced from the accepting countries. In this multi-crisis panorama, worsened by the COVID-19 pandemics, feminist movement and women, we have continued to promote measures to counteract the effect of non-compliance of commitment and obligation by state, providing answers to situations where the life of women were endangered, generated soup kitchen, free lines, shelters, free work that we feminists are making for decades in the face of a state that ignored the acknowledgement and guarantee of our rights. Throughout this articulation with our social movement of other countries like Chile, Mexico, and Colombia, we are alert due to the repression that take place in the whole region. And in this context, we reject the government of Ecuador, a country where there's a large demonstration of population led by the indigenous movement, added to social movement with urgent demand for health care, education, social protection, access to credit. The government has responded by using the figure of a state of exception, the use of non-lethal and lethal weapons, criminalization of social leaders, and denial of dialogue, with 313 wounded persons, 6 deaths, and 145 people in prison. We urge Latin American and Caribbean states to reaffirm and fulfill the agreements of a Montevideo consensus that provide a response to all the issues here with dignified and enough budget, ensuring the access to human rights, to commit to establishing multi-sectorial and participative mechanisms with civil society and the youth, including formal reception of the reports prepared thereof. In this sense, it is essential the countries of the region move from austerity policies with designing and implementing public policies with intersectional approach of human rights, with special focus on eliminating corrupt and structural violence products. Otherwise, the Montevideo Consensus on the Agenda 2030 will be deeply compromised in their achievement. As feminist and women organization, we stress that there is a key in our agenda for the consolidation of real substantial democracy based on equality, non-discrimination, with social justice, gender justice, ethnic, racial, environmental, economic, sexual, and reproductive justice. We remind that robust democracies are those where the human rights of everybody are respected and promoted. We urge that the mechanisms to follow up the agreements and resolution of this conference are consistent with what is established in international human rights mechanisms. Likewise, that state include in the report policies and mechanisms to fulfill Montevideo Consensus and the agreement after this conference. We urge the state to include as part of the agreement of this conference the holding a special session for the celebration of the 10th anniversary of the adoption of Montevideo Consensus, in which the countries will account on the status of the implementation of their commitment with active participation of civil society organizations. Our human rights should not be on quarantine. There is a regional emergency for the violation of right to a free life free of every form of violence, discrimination. You are forced to ensure, and you have the historic opportunity to fulfill the agreement of Montevideo Consensus. We are millions of women, children, adolescents. We will continue the dialogue and we will survey there is no setback. We are the force and the voice of the change for us and for those who are coming or folks that are no longer here. We are history. Sorry, but she was speeding. It was very difficult to translate. Sorry for that.
Se agradece el informe presentado.
We thank the report presented by the civil society on what they have discussed for 2 days in their meeting here in Santiago. And now we invite Adriana Casanova to present the results of the activities of the youth. Good morning. I am Briana Casanova from Nicaragua. I'm a trans woman. I'm living with HIV and Afro-descendant. I come from the coordination of the Latin American Network for Adolescent with HIV positive.
Y en el foro de juventud.
The youth of Latin America or the Caribbean who participated in the construction of this declaration and in the Youth Forum towards the 4th Regional Conference on Population and Development identified various problems in the exercise of our human rights related to issues contained in the Montevideo Consensus. We note that the pandemic has widened and made visible the gaps of inequality, violence, stigma, and discrimination, which from the perspective of intersectionality we identify as problems that threaten the dignity of our lives. To this, we can also add the discourses of fundamentalist and anti-rights actors, which distances us from the horizon of inclusive and accessible development to which we all aspire. We make an urgent call to think about the world from the perspective of children, adolescents, youth, and women in their diversity and interculturality, in order to address the historical debt that exists in the recognition of our needs. We find ourselves in a context in which femicides and different forms of patriarchal, genocidal, misogynist, racist, and colonial violence threaten our individual and collective human rights. And therefore, we ask that the exercise of these rights not be disconnected from other social movements and struggles. We demand that the relevant authorities of the countries guarantee the full exercise of our human rights and that they comply with international commitments, especially the Montevideo Consensus, through a number of recommendations. 1. Ratify international human rights conventions and treaties for those countries that have not done so. 2. Guarantee the fulfillment of individual and collective human rights, as well as strengthen, develop, and implement institutionalized participation mechanisms with a gender perspective, cultural relevance, and with reasonable adjustment so that all young people in their diversity may have access to them. 3. Generate information and databases disaggregated by sex, sexual orientation, gender and ethnic identity, age, disability, economic situation, and mobility, among others, in order to understand and make visible the differentiated impacts of the problems. 4. Invest in quality, non-sexist, secular, free, and culturally relevant public education at all levels, incorporating comprehensive sexuality education with relevant adjustments to each population. 5. Guarantee and invest in quality and accessible public health services with a focus on bodily autonomy, mental health, and the exercise of rights, especially sexual and reproductive rights with an intercultural, youth, gender, and disability perspective. It is also necessary to ensure the availability of inputs, medications, information, and contraceptives. 6. Train and raise awareness with the direct participation of young people, of public servants on sexual and reproductive rights and a youth, gender, multicultural, anti-traffic, anti-racist, and anti-discriminatory perspective in order to provide comprehensive quality care. 7. Decriminalize and legalize safe and free abortion in all countries with quality services with specialized and trained personnel who do not discriminate, stigmatize, or criminalize women and pregnant women, and providing information based on scientific evidence and inputs for self-managed abortion. 8. Allocate resources to the prevention and eradication of gender-based violence in all spheres and to comprehensive social, legal, and economic care for the reparation of people in situations of violence. 9. Recognition and protection of young sex workers over the age of 18. 10. Guarantee constitutional recognition of the Afro-descendant and indigenous population, in addition to generating affirmative and differentiated public policies to reduce the inequality and discrimination gaps they continue to face. 11. Respect the right to autonomy and self-government of the indigenous peoples and communities of the region and value the education, art, culture, history, and ancestral knowledge of indigenous and Afro-descendant peoples. 12. Protect and guarantee the rights of migrants, refugees, and asylum seekers, especially those of children and adolescents and youth. 13. Broaden participation and take into account the specific needs of persons with disabilities by ensuring reasonable accommodation of accessibility to their rights. 14. Respect and guarantee freedom of association and organization, creating protection mechanisms for victims of political and police violence, particularly for environmental, land, and territorial defenders, respecting their right to the freedom of expression and life without criminalizing, persecuting, or murdering them. We demand that this document be adopted by states and UN agencies to promote the advancement of youth rights in our diverse context, and we call on the youth of the region to continue articulating and working together to defend our rights. We urge that youth belonging to civil society organizations participate in the evaluation and reporting on the implementation of the Montevideo Consensus and that countries take them into account in their official reports. We also ask that youth be supported with training and resources for participation and advocacy and follow-up and social monitoring mechanisms. We also propose the creation of a special session on youth in the framework of the commemoration of the 10th anniversary of the adoption of the consensus in 2023. The COVID-19 pandemic brought us great challenges, and today we have the opportunity to change and address the structural causes of the inequalities and violence that young people in all our diversity experience every day. Historic, we are present and we're part of the construction of a fairer world. So nothing about young people without young people. Thank you.
Agradecemos el informe.
We thank the speaker for the report. We've heard the reports of what has been done in recent years on population and development and also the outlook. With the collaboration of the Secretary, we will now open up for interventions by delegations on this matter. We move on to the interventions. We recognize the delegation of Uruguay. Minister of Women, that is, avoiding compulsory lockdowns or states of exception that would have restricted citizen freedoms. At the same time, monitored the development of the pandemic and early on reached agreements with the scheme of vaccination. Today, Uruguay has levels of job creation higher than those in the pre-pandemic period, and many thousands compatriots have overcome poverty. In the second half of 2021, poverty was estimated at 7.6%, implying that the level of indigence stands at 0.2%, which means that for every 1,000 homes, only 2 do not exceed the necessary income to cover the basic needs for food. These figures are official from the National Statistics Office, the agency with a sound reputation that operates independent of governments. Development in Uruguay. Uruguay has 3.5 million that is not free of the current trends affecting Latin America and the Caribbean. Growth is down and the population is aging. We can see a constant fall in the global fertility rate below the last 2 decades. It is important, likewise, the impact of migration recorded in the 2002-2019 period is among younger generations. As a result of this demographic process, in coming years, Uruguay will require of reforms to sustain economic growth and ensure the social protection. Likewise, it is relevant the role played historically by social policies in our country by means of a universalist matrix that can be seen in the expansion of social rights over more than 1 century, a universalist matrix that has been enriched with new instruments for focusing. The reduction of poverty is a priority aim for the government, addressed based on a multidimensional analysis aiming at strengthening and designing comprehensive policies. In the attainment of these aims, we always have the support by the UNFPA that was expressed, among other documents and instances, in the Montevideo Consensus on Population and Development, which arose from the first session of the Regional Conference on Population and Development in Latin America and the Caribbean, held from 12th to 15th of August 2013 in Montevideo. And so our region prepared to contribute to the action program of Cairo after 2014 in order to analyze the full addressing of population and development based on equality and the rights-based approach. Challenges of the social government in Uruguay. We are working on the 2023 version of the population census by the National Statistics Office. To mitigate the impact of the pandemic on these populations, the government strengthened cash transfers and family allowances and the social Uruguay card for an approximate total of $15 million from March 2020 until March this year, and also create a food bond for the informal sector workers who saw their income affected very significantly. And this was awarded through the 2-app for use with mobile phones, especially designed for this particular benefit. The emergency implied a tremendous economic effort in health because the coverage of the National Health Fund was extended to laid off workers. With regard to Social Security, the insurance for people over the age of 65 was extended, as well as health workers, and there was a partial unemployment benefit. A monthly subsidy was created for national artists and also a cash subsidy through the Ministry for Social Development, and that covered 12,000 people. Priority is given to caring for people who are homeless, and the number of homes taking part was extended, creating also new housing solutions, including the rental of hotels for this purpose. These actions were aimed at protecting life, ensuring the vaccination free of charge and according to health provisions, thereby making it possible to cover 85% of the population with 3 doses by 2021. In education, measures imply the temporary suspension of face-to-face classes, but as of April 2020, education resumed in person gradually. Uruguay, during most of the pandemic, continued education, operating at all levels. Essentially, the food service was kept for early childhood and for part-time or full-day students. And also the Saival plan and the connectivity in the territory made it possible to continue online with the various education on our migrant population to ensure their rights and access to basic food services, health, education, housing, and formal employment. The agenda and the challenges for the future. Lastly, we also want to underscore the progress furthered with regard to early childhood in line with what we described earlier at the Ministry of Social Development. We have decided to give priorities to and strengthen social policies for children aged 0 to 3 and their families. The plan comprises 5 pillars of work: family, accompanying the strengthening of care policies, the special bond, and integral systems, favoring social labor inclusion. This is another essential aspect: access to the labor market, for which there are several lines of work: the access program, study and work, solidarity, venues, and plans by the National Association, among others. Consolidate the humanization and professionalization of care in our countries. Uruguay has also been a pioneer in the creation of integrated care based on a special law of 2015. However, it is understood that it is necessary to review and redesign some aspects. And in this sense, in 3 departments, a pilot plan is being tried out with a new mode for collective insurance in order to improve and ensure the sustainability of the program for people who are dependent. And likewise, there's been a special program to support constant care, and in the first reassignments of elderly persons have been rearranged on account of specific risks. We're committed to care with a new approach, a model of professionalization and humanization, and where people are at the center.
So we have new institutions for affirmative actions for Afro-descendant persons based on a law of the national budget. This administration creates, in the framework of the Social Development Ministry, the Division for the Promotion of Public Policies for Afro-descendants. Their competence is to do affirmative actions in order to contribute to promote policies that aim at improving the life quality of Afro-descendant persons. Without any doubt, this is a great advancement that will strengthen the implementation and the follow-up of the compliance of the legal framework in force. This will allow to reduce the inequality levels that still exist in this population in our country. Gender equity, the guidelines of public policies included in the law also are implemented so as to have preventive, protection, sanction, and repression measures. in women who experience gender-based violence. We will increase the budget and the coverage of the response system in all the country. Regarding the exercise of the political rights of women, we have initiated a program for the strengthening of political leaders throughout the country in order to promote access of women to decision-making positions and leadership positions. The gender information system has been consolidated as a national reference for the production of specific indicators and for the generation of knowledge. We have the third edition of the National Survey on Utilization of Time in coordination with the National Statistics Institute. Allow me to conclude with the words of President Luis Lacalle Pou in his message to the 75th session of the United Nations. Go from commitments to actions is a necessary condition to put an end to poverty, to protect the environment, and to improve the living conditions of the population. This implies, on the one hand, to accelerate key reforms in the field of education, care of early childhood, and eradication of precarious houses, and also reinforce the policies that accelerate economic growth so as to compensate the deviation and provide the resources to comply with our commitments in due time. We know that the challenges that the social agenda of the Uruguayan government faces will have the support of national institutions, and especially will have the support from UNFPA, UNICEF, and the Economic Commission for Latin America, amongst others. Thank you very much.
Agradecemos la intervención de la representante.
Thank you for the intervention of the representative from Uruguay. I will mention the delegations that have asked for the floor. We have Jamaica, Peru, Colombia, Cuba, Argentina, St. Lucia, Costa Rica, and Mexico. Now we will listen to the interventions until 1 o'clock. Then we will have a recess and we will come back at 2:30. We would ask you for your interventions not to go beyond 5 minutes. So we continue with the delegation from Jamaica.
Gracias, señor presidente. Señor presidente, other members of the Bureau, distinguished delegates, observers, members of the Secretariat, ladies and gentlemen, it is indeed my honor and privilege to make a statement on behalf of the government of Jamaica. The first official case of the coronavirus disease, COVID-19, in Jamaica was reported on March 10th, 2020. Although the government of Jamaica had begun its planning and implementation of measures in anticipation of the disease reaching our shores, forecasting precisely the health, social, and economic impacts of the pandemic was considered problematic, at least given the newness and inadequate information about the disease. Our initiative meant that policymakers and planners in Jamaica needed to consider simultaneously the emerging service, the emerging evidence, the interactions between the pandemic and population dynamics, and the implications for social and economic well-being in the medium to long term. This was pertinent to maintain the general health and population and to prevent retrograde steps in sustainable development. The pandemic's immediate impact on the social, economic, and demographic well-being of the population has been profound. While the government has implemented a combination of preventative and responsive strategies and measures against the pandemic, most, if not all of these, had not hindered the disruptive negative consequences for all the productive and service sectors with health, education, tourism, and the labor market being particularly affected. Some of the key preventative and control measures included public health measures on hygiene, including regular hand washing and mandating the use of facial masks, mass screening and testing, social distancing and limiting public gatherings, closure of schools and training institutions, movement restrictions within countries ranging from nighttime curfews, partial and national lockdowns, international travel restrictions, including full border closures and international air traffic closures. It should also be noted that the most restrictive measures were implemented to control the upswing of the waves of the pandemic, while there was some relaxation as the waves subside. El Señor Presidente, Jamaica's experience with managing the pandemic has highlighted a number of key challenges that have come into sharp focus or exacerbated by COVID-19. These include vaccination hesitancy, disruptions in sexual and reproductive health services, and in general, including mental health and family planning, interruptions to academic calendars and learning, job losses and reduced incomes, inadequacy of ICT platforms, equipment, and geographical spread of services, gaps in the accuracy, timelines, and completeness of longitudinal data from health and demographic surveillance and administrative sources, financing a balloon in health budget to facilitate effective service delivery. Señor Presidente, with due consideration to the challenges noted above and the need to safeguard the health and well-being of the population, the government had to develop targeted medium to long-term recovery strategies to address similar future public health emergencies. The following are recommended for consideration. Making concerted efforts to have all segments of the population fully vaccinated against COVID-19 as appropriate. Ensuring that comprehensive sexual and reproductive health and reproductive rights services are adequately funded and that there is full resumption of services, including family planning, adolescent sexual and reproductive health services, and youth-friendly services. Collaborating with development partners and civil organizations to design effective interventions to reinforce adherence to existing laws to protect girls and women from sexual and gender-based violence, which has escalated during the pandemic. Implementing robust return to school strategies that will ensure that all students are able to safely return to their institutions of learning with a particular focus on disadvantaged groups. Re-energizing the productive sector through provision of business incentives, including low-cost credit facilities to enable startups and recovery of affected businesses. Enhancing the responsiveness and effectiveness of social protection measures to cushion those who have suffered critical income loss as a result of COVID-19. Investing in enhancing the development and use of digital technologies that have been critical across all sectors into prevention and recovery measures. Enhancing investments in data and policy-sensitive studies to inform both the short-term and long-term responses to COVID-19 and similar episodes that may occur in the future. The long-term implications of the pandemic on the prospect of Jamaica's achievement of its demographic policy strategies and objectives are likely to be serious, and therefore a robust evidence-informed response reinforced by an effective measurement and monitoring system is required in order to mitigate against these adverse effects. To safeguard the health and well-being of the population from the impact of COVID-19 and similar future public health emergencies, the government of Jamaica will continue to develop and implement targeted and short and long-term recovery measures to ensure the full integration of population dynamics into sustainable development with equality and respect for human rights. In line with the policy and program framework of the Montevideo Consensus, Jamaica will continue to advance its policies as it relates to programmatic and operational frameworks to improve services to our children, adolescents, youth, older population, persons with disabilities, and the most vulnerable, whilst working assiduously to protect the human rights of all and leave no one behind. Señor Presidente, in the words of our global reggae icon, the Honorable Bob Marley, one love, one heart, un amor, uno corazón, una humanidad. Saludos a todos. Gracias.
We thank the intervention of the representative from Jamaica, and we continue with the delegation from Peru. Well, this will be a short intervention, but I must participate at this moment to make a recognition to the declaration of the feminist declaration and civil societies, activist civil societies that are meeting, that have met in this conference that they have just read to us. I believe it is healthy for us to have in Latin America and in the Caribbean the group of these organizations, civil society organizations, feminist ones, that remind us of the commitments and challenges that governments have committed themselves to. So as the government of Peru, we will take them into account, and we will do the necessary to have a special session in the 10th anniversary of the Montevideo Consensus, to have a session for the youth also, and to commit ourselves with the recommendations made by feminist organizations and women's movements. I also want to take advantage of this opportunity to express to Mr. Marcelo Pisani that I believe that it is fundamental that in the Global Compact of Migration, we should include the different types of gender violence of the migrants, affecting mostly women, girls, and adolescents. I'm glad that there is a point regarding access to justice, but as long as it doesn't become a special chapter, in the case of our country, we have 1,400,000 Venezuelans, half of that population are women and girls, and we even have difficulties for the access to our own services, for the Aurora program on violence. We have to continue to insist that the services that we have in our country, we have to make sure that they are for anyone who lives in our countries and where we are receiving this migration. So I request to you very especially, with the work that you are doing at the OIM, I ask you to include the gender-based violence, and especially for girls, adolescents, and women, be included as a chapter, as part of the Global Compact. Thank you very much. We thank the intervention of the delegate from Peru. Now we will listen to the delegation from Colombia. Thank you very much, Mr. Chair, and I would like to greet all the members of the presiding officers. And I would like to thank the CELADE ECLA team that have presented the report today. We, besides greeting you, we would like to thank all the participation of the academic world and the civil societies and the other representatives of the countries and other organizations. From Colombia, we would like to highlight the activities between 2018-2020 presented by CELADE, because it is an excellent example to show how the different ways to work that the pandemic brought about and that are here to stay have brought about important progress. We thank the Technical Secretariat and ECLAC for having maintained the pace of work and for having been able to adapt to a reality that had never happened in humankind. This report for Colombia moves us to continue to work at an institutional level. We have the work to support the work of the countries for the 2020 round of census. This will also help many citizens, and this includes all the dialogues, the thematic dialogues that were organized by ECLAC and the UNFPA. We believe that in the empowerment exercises that they raise awareness regarding that agenda, like regarding the Montevideo Consensus, and these commitments finally have a positive impact on our populations. I would like to outline the importance of creating the virtual platform to follow the Montevideo Consensus. This is a tool that provides different possibilities and give new possibilities to the governments, the civil society organizations, and international agencies. They provide them the possibility to do the follow-up regarding the implementation of the Montevideo Consensus. We would also like to recognize the work of the UNFPA, the preparatory meeting of the civil society, the meeting on aging and rights of older persons, and the International Organization of Migrations. There are so many actions that have been advanced in their own spheres to leave no one behind in our region. Now, regarding the outlook for the 2022-2024 period from Colombia, we celebrate that there are initiatives like ECLAC-STAT, CEPAL-STAT, and other data banks. As has been repeated, the statistic information and data have to be treated as regional public goods. In Colombia, we have understood the importance of showing statistics and producing statistics that make visible the living situations of all the populations and the inequalities amongst them. Better data lead to better understanding of economic and social phenomena, and better decisions help our populations. We believe it is totally pertinent to continue with some of the tasks that have been carried out, like the support to the census round that had to be postponed in many countries due to the pandemic. And also we have the support to include populations that have been historically discriminated, like indigenous peoples, the Afro-descendants, the persons with diverse gender identity. In the statistics and demographic analysis, we should include not only censuses, but also social surveys and administrative registry that enable the visibility of these populations. We also invite to continue to work hard in concluding the development of the virtual platform to be able to follow the Montevideo Consensus. From Colombia, we would like to reiterate our request to maintain the characteristics of each of the states present here. So we emphasize the need to maintain the articulation with the public institutions and UN system with the residents of each country in order to define specific actions that will allow us to build synergies not only between the public and private sector, but also with the civil organization that is here with us today, avoiding duplicity and aligning ourselves with each of the national demands in the framework of the Montevideo Consensus. Thank you very much.
Representative of Colombia, and now we continue with the delegation of Cuba. Good afternoon, Mr. President, and thank you very much. I take the opportunity to reiterate that our offer made yesterday by our Minister of Delegation to your country for the full success of this fourth conference on population and development in Latin America and the Caribbean. I also take the opportunity to acknowledge all and congratulate all intervention, because everything that we have had 2018, 2022 seems a lot considering the huge problem of the pandemics. Looks a lot, but it's much more that we have not do what needs to do. And yesterday the minister intervened. He was very clear, very precise. But I want to take this opportunity and this activities report 2018-2022, and we foresee for the 22-2024 to focus our attention in two things. First of all, as acknowledge the participation of civil society, their claim, fair claim, the intervention of the UNFPA, and we appreciate that we have the right to work together and learn and thank and appreciate that we are all here present with their support, and CELADE, that we have been working for so many years, and in the years to come also. Another intervention for the representative of the International Migration Organization. We are in two international arenas, and it's very emotional to see ourselves all together today. Maybe we cannot hug ourselves because of the pandemic, but after 4 years, this is very important. But there are two international environment that we can see and view and differentiate. One is the 10th anniversary of the Montevideo Consensus. Next year, there will be presiding officers, even the preparatory meeting for the conference that we held a month ago. We discussed to organize a specific event to celebrate the 10th anniversary because of the meaning and importance of Montevideo Consensus. And we will celebrate at least next year. I was talking to my colleagues of the Delegation of Bolivia. Everything that we could not do in 2019, and for the reasons that we all know, what are we going to do with the consensus? But along with celebrating the consensus, submission of reports and presentation, we need to focus our attention, and this is some of the intervention, and we need to ratify and expand it. What are we going to do with the 30th anniversary of the International Population and Development Conference of Cairo, which is the master document, and we need to be reminded about the importance of Latin America, of Caribbean, that this is taken to a good end. The 20th anniversary was not good. It was chaired by the Commission on Population and Development of the United Nations, a country of Latin America, and the outcome were not good. And we have been very attentive in the CIPD, in the Commission for Population and Development of the United Nations. Sometimes fundamentalist forces appear that want really to destroy the language of Al-Qaeda, not because it's an agreed to language which cannot be changed, but because of the relevance of Cairo. And we need to project ourselves from 2023. And if we organize a 5th conference in 2024, we need to join forces. We have been able to build the Montevideo Consensus and taking this from 2018. It involved the president, the chair of the presiding officers, but we need to present a strong position, a document in relation to the 30th anniversary of Cairo. it is already mandated by 55th period and the 47th period of the Conference of Population and Development. They will analyze the 30th anniversary of Cairo and its relationship with the SDGs. And this is very important to reach a common position. And in order to respect the 5 minutes, reading Zulma, excellent report of CELADE, the UNFP and all participants, I make my accounts. And CELADE, your anniversary, Simon, you are celebrating your 65th anniversary of the creation of the Latin America population and demography. I remember when we celebrated 50th anniversary of ICLAC, and you can say 65th anniversary. It's an elderly adult. No, it's a rejuvenated center to which we owe a lot of gratitude. And I want to congratulate you on behalf of my country, and I'm sure that this is what other delegations also feel. Thank you. We thank the intervention of the delegate of Cuba. And now we continue with the delegation of Argentina. Thank you, Mr. President, and I wish my warm welcome to representative of civil society and the United Nations Agency. From the Republic of Argentina, we celebrate the progress made, and we reaffirm our commitment to continue to advance together so that our regional navigation chart becomes a daily reality that allows us to emerge from the pandemics in a better manner. We are pleased to see the virtual platform in which the government and civil society will be able to share achievements and pending goals in this spirit. That from the National Direction for Migration, depending on the Ministry of Interior of Argentina, we want to contribute some elements to reinforce the agreements for migrant people achieved in Cairo, Montevideo Consensus, and the objective of the Global Compact for a safe, orderly, and regular migration and the Agenda 2030. At the beginning of the pandemic, our state should adapt rapidly and not scarce resources to the closing of borders. Our migration law guarantees all migrants universal free healthcare coverage. Is more like 5% of the Argentinian population. We extended the visas. We supported family reunification, among other measures included in the voluntary national report and the regional examination of the compact application, and also in the national report presented at FEMA in the Forum for Review of International Migration in May this year. For the next stage, we need to stress the policies that countries launched during the pandemic. They will continue to be reinforced in the years to come, and many of which I will mention I presented today by the Migration Network of the United Nations and good practices to be replicated for Migration Argentina with territorial approaches in order to avoid the most vulnerable neighborhoods. And we implemented the certificate for digital precarious residence certificate that allows migrant population to regularize the status of migration automatically instead of going to perform a in-present procedure. Migrant persons also can work legally and rapidly in the country, avoiding exploitation and vulnerability. We also implemented an electronic affidavit and we eliminated physical stamp, improving the efficiency of the borders management, avoiding traffic of people. In this line, we also created in 2020 a early detection of trafficking at the borders, and we submitted a recommendation draft approved by the Mercosur Common Market Council. Also, we have the portal Open America during the pre-temporary chair of Argentina, specialized forum of Mercosur, and the Conference on Migration on 2021. We launched the portal Open America with the support of the IMO for Development, ensuring that millions of migrants and key stakeholders have access to updated, reliable information on the measures adopted by governments regarding healthcare and sanitary measures. We expanded the modules to incorporate regulation of childhood and requirement for eradication in each one of our country. And we invite all those here present to visit the platform and spread it. Finally, we want to stress the need to work in the years to come on forced displacement of people caused by climate change in order to assume shared but differentiated responsibility that we and the state have with displaced migrants. We have, among other initiatives, Mr. President, in Argentina, since 2004, we have an comprehensive migration law that ensures same rights and freedoms to the country persons and considers migration as a human right. In this government, we know that we have a lot to do, but we are convinced that our duty is to not leaving anyone behind, no one behind, not in isolation, but we need to think and work with international cooperation and civic participation. Thank you. We thank the intervention of the representative of Argentina. And now we continue with the delegation of St. Lucia. And then for a break for lunch.
Mr. President, good morning. Ministers, officials of UNFPA, civil society, I also convey good afternoon, I think it is, to all of you. On behalf of the St. Lucia delegation, the 180,000 people of St. Lucia and the government of St. Lucia, I wish to express sincere thanks to ECLAC and partners for organizing this important dialogue and to also congratulate the incoming chair and presiding officers. Let me also say that we lend our support to the Montevideo consensus and its priority areas, noting its complementarity with the goal of St. Lucia and its ongoing social protection reform program. Like other nations and of the Latin American Caribbean region, indeed, the world COVID pandemic has had a significant negative impact on the health, social, and economic sectors in St. Lucia and has effectively contributed a reversal of the hard-won gains that we've made over the years. On the health front, as of June 27, 2022, St. Lucia recorded 26,070 cases of coronavirus and 380 COVID-related deaths. And of course, the backdrop is that we have only a population of 180,000 persons. Additionally, the pandemic has caused considerable strain to the health sector infrastructure as well as on the already overburdened health personnel who work tirelessly to care for and take care of our sick persons. Let me get this. Although not measured, we have also acknowledged a negative impact of the pandemic on the mental health and the mental well-being of individuals owing to isolation, increased vulnerabilities, and other concerns. Turning to the impacts on on the economic and social sectors, the COVID-19 pandemic has also contributed a major disruption resulting in decline in government revenues in the face of growing expenditure needs. According to the World Bank, lockdowns and the halt in tourism and tourism-related economic activities resulted in 20% reduction in St. Lucia's gross domestic product, a contraction which resulted in an increase in poverty between 2019 and 2020. In addition, the statistics shows a significant reduction in wages of households and reduction in remittances from abroad, as well as a decline in domestic transfers from relatives. Some households experience difficulty in accessing basic needs such as food and medicine, with poor households being more likely to experience these. The negative impact on children was particularly felt with prolonged school closure and the inability of households to secure learning devices to facilitate online learning or adequately meet their nutritional needs. We note that such situation may have prolonged or long-lasting negative implications for cognitive, language, and physical development, and may jeopardize sustainable growth and poverty reduction efforts. In responding to the pandemic, the government of St. Lucia took decisive action to confront the economic and social fallouts, scaling up social protection mechanism and rolling out several new ones in an effort to provide relief and protect the population. COVID-19 response action included the horizontal expansion of the public assistance cash transfer program, which resulted in a 50% increase in coverage of households. Temporary vertical expansion of the child disability grant and foster care and a social assistance program for persons living with HIV. Expansion of our home care program for the elderly and persons with disability, as well as distribution of hundreds and thousands of food and hygiene packages to poor and vulnerable households. An electricity assistance program, as well as an income support program for non-contributors to the National Insurance Corporation, as well as transport permit holders and licensed bar owners who also received support from the government. Learning devices were provided to children to facilitate continuity and learning. While full coverage has not been achieved, it is the intention of the government to do so. In August of this year, the government of St. Lucia will unveil another COVID-19 response project designed to provide additional support to the unemployed, the homeless, children in poor households, and those with special needs and beneficiaries of our social assistance program. The government of St. Lucia remains committed to strengthening the social protection system and closing the inequality gap. Of note is the achievement of the policy and legislative front with the recent enactment of the domestic violence legislation. A piece of legislation complements the Child Justice Act and the Child Care Protection and Adoption Act, which was passed in 2018. And this is part of our family law bills. Additionally, the government of St. Lucia is currently working on the social protection legislative, as well as policies for social protection, older persons and persons living with disabilities. Also noteworthy is the establishment of a unit within the Ministry of Health in 2021 for dedicated focus on issues relevant to older persons and aging. The government will continue to work towards the establishment of a social protection system that is robust, gender and shock responsive, comprehensive and inclusive, leaving no one behind, and that effectively supports the national development agenda. the St. Lucia delegation and our Prime Minister calls for revisiting the current approaches and embrace a more aggressive collaboration and strengthened resolve in an effort to achieve greater impact on the people's lives in Latin America and the Caribbean, so that in reality, no one is left behind. I thank you.
Agradecemos la intervención del representante.
We thank the intervention of the representative of St. Lucia. And now we are stopping here for the lunch break, and we are back at 2:30. During the recess, different parallel, online, and face-to-face events they are arranged. So this is a part of a parallel events. When we return, we're going to listen to the delegation of Costa Rica, Mexico, and Venezuela.
De los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. la cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. De políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones, el sistema de Naciones Unidas y otros organismos multilaterales, todos en la tarea de dar cumplimiento a las medidas prioritarias acordadas en el Consenso de Montevideo, las cuales complementan y hacen sinergias con las metas que componen la Agenda 2030 para el Desarrollo Sostenible, considerando la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe es un órgano subsidiario de la CEPAL destinado al seguimiento y la revisión de los temas relacionados con la población y el desarrollo, como la salud sexual y reproductiva, los niños, niñas, adolescentes y jóvenes, las personas mayores, la migración internacional, los pueblos indígenas y las poblaciones afrodescendientes. Desde su primera reunión en 2013, cuando se adoptó el Consenso de Montevideo sobre Población y Desarrollo, uno de los logros de la conferencia ha sido la institucionalización de los temas de población y desarrollo en las agendas de los gobiernos de la región. Asimismo, las organizaciones de la sociedad civil han tenido un rol protagónico, impulsando nuevos temas y expandiendo la agenda de discusión. La conferencia cuenta con el apoyo estratégico del Fondo de Población de las Naciones Unidas. La cuarta reunión de la conferencia, que fue postergada en 2020 debido a la crisis sanitaria mundial provocada por la pandemia del COVID-19, se realizará en la sede central de la CEPAL en Santiago de Chile bajo una modalidad híbrida, es decir, presencial y virtual, del 28 al 30 de junio de 2022. Durante el encuentro, altos representantes de gobiernos, instituciones internacionales, sector privado, academia y sociedad civil se darán cita para analizar los impactos sociodemográficos de la pandemia del COVID-19 en la región y los retos que plantea la crisis sanitaria para la implementación del Consenso de Montevideo, el acuerdo intergubernamental más importante en materia de población y desarrollo en América Latina y el Caribe y uno de los más avanzados del mundo. Para la implementación de políticas que garanticen el pleno ejercicio de los derechos humanos en temáticas tan relevantes como la salud sexual y reproductiva, el envejecimiento de la población, la migración internacional, los pueblos indígenas y la población afrodescendiente. El Consenso de Montevideo incluye 108 medidas prioritarias sobre 10 temas identificados como prioritarios. Es complementario a la Agenda 2030 para el Desarrollo Sostenible y establece un marco conceptual para lograr el desarrollo sostenible, poniendo en el centro el respeto y la promoción de los derechos humanos de todas las personas con perspectiva de género e intercultural. Constituye además la base de una hoja de ruta integral y actualizada para el futuro de la acción regional en temas de población y desarrollo, con énfasis en la importancia de la dinámica demográfica. Aborda asimismo las desigualdades en distintos grupos de población en función de la edad, el territorio de residencia, la identidad de género, el origen étnico y racial, la orientación sexual, la condición migratoria y la discapacidad, entre otras dimensiones. El Consenso de Montevideo es el acuerdo intergubernamental más importante de América Latina y el Caribe en materia de población y desarrollo. Para transformarlo en una agenda operativa, los países de la región alcanzaron en sucesivas reuniones acuerdos sobre los procedimientos, actividades y responsabilidades sobre el proceso de implementación del Consenso de Montevideo y destacaron la importancia del seguimiento y la rendición de cuentas como componentes fundamentales para velar por el cumplimiento de las medidas prioritarias. Con este objetivo, la CEPAL desarrolló la plataforma virtual para contribuir al seguimiento regional del Consenso de Montevideo, un espacio que reúne las principales iniciativas reportadas por los países y los logros alcanzados con respecto a la población, sus condiciones de vida, el ejercicio de sus derechos y su desarrollo. En otras palabras, procura sistematizar los procesos y los resultados alcanzados en la región para dar cumplimiento a los compromisos asumidos en relación con el consenso. Se trata de un instrumento que se alimenta a partir del trabajo y esfuerzo colectivo de muchos actores en nuestra región, como son los gobiernos nacionales y locales y su institucionalidad, la sociedad civil y sus diversas organizaciones.
Estamos. La delegación. Costa Rica, ¿no? Bueno, muy buenas tardes.
Afternoon. Let's resume our agenda. Pending were the presentations by Costa Rica online. Thank you, Chairman. Thank you for this space and giving us time to speak. We would like to thank everyone in the presiding officers and also the members of the previous panel. Fernandez from UNFPA, Minister Borba from Paraguay, Minister Diana Miriam, Ms. Lagos from Peru, person from CELADE, CEPAL, Pisanio from the IAO, International Organization for Migration, and the members of the civil society and the shared information of this morning and afternoon. The information presented by you has led to a series of activities, outputs and inputs and findings that for Costa Rica are very interesting in the planning and implementation of human rights for the entire diversity of the population, such as women, sexual and reproductive rights, aging as part of the life cycle, a cycle that must be addressed after gestation, all the way to the culmination, respecting the quality of life of people throughout their childhood, youth, adult life, and old age, and indigenous people and Afro-descendants. And that is why, for the delegation of Costa Rica, these important conclusions and recommendations will strengthen the planning process and the process to implement the Montevideo Consensus on Population and Development with a view to the public interventions, public policy, plans, programs linked to the principles of the 2030 Agenda for Sustainable Development within the universality, participation, and social inclusion, population and human rights approach. That in the case of Costa Rica, we hope to materialize and show them with a sustainable and inclusive development. To resume the desired future for human, economic, social, environmental, and technological development for the entire population. Although Costa Rica has presented two Montevideo Consensus reports, one in 2017 and the other in 2020, it is in this space that we commit to continue to move ahead with regard to the implementation of the Montevideo Consensus on Population and Development and have a country report that is a second-level report based on the standards for these reports. A recommendation that our reports should not forget the past presented in the first reports and should determine the condition in terms of human rights that had been addressed in the current situation with the change in administration or with the population censuses and projects, which are the main strategies or strategic actions taken with a view to a desired future within the framework of a correct strategic planning. As is good practice for the country, the report, the national report, as well as the system of indicators for the follow-up of the Montevideo Consensus linked to SDGs. We did this together with the civil society organizations and the UN Population Fund here in Costa Rica. So thank you very much for all efforts made and contributions so that our states may move ahead in proper action with regard to human rights for the entire population. Thank you. Well, we thank the representative of Costa Rica for that statement. And now we continue with the Delegation of Mexico. With your permission, Chair, Mexico recognizes the intense and atypical way that the regional and world order has been affected by the SARS-CoV-2 pandemic. The pandemic reached Mexico with a government where human rights have become central, eradicating social exclusion and extending sexual and reproductive rights, as well as social well-being for all population groups. That is the priority, especially for those who are living in poverty, girls, women, children and adolescents, sexual diversity, indigenous, and persons with disability. The guiding axis of public policy has to do with the presidential slogan, for the good of everyone, first the poor. The actions by the current government is in line with the priorities and the progressive vision of the Montevideo Consensus. One transcendental decision with regard to the pandemic was to make use of state resources and redirect public spending towards strengthening the health sector. Saving lives has been the beacon of our health policies. It was colossal, the effort made in infrastructure, inputs, and health personnel, and with measures for prevention, distancing, and social lockdown, the balance between preserving human rights and reducing the rate of virus spread, and so prevent a collapse of the health system. Transparency, truthful information, and accountability were principles that regulated our communications. At the start of the pandemic in March 2020, Mexico was able to do the 2020 national census of the country. So we had updated data and solid grounds on which to base our emergency strategy, identifying the volume and location of vulnerable populations and provide medical care and vaccination on a timely basis. With regard to COVID vaccines, 86% of the Mexican population over the age of 12 was covered, 91% of persons aged over 18, and 54% of girls, boys, and adolescents aged 12 to 17. To control death rates, the excess mortality for all causes was monitored, and they showed a surplus of 43% in 2020, of which 66% were associated to COVID, and the surplus percentage rose to 47.2% in 2021. That is 71% associated to COVID. The entities most affected by COVID were those that have large cities, border areas, and tourist centers. In the multilateral sphere, Mexican leadership became visible with regard to the humanitarian treatment and global and equitable access to medication, vaccine, and medical team support. In order to face contingencies, more than 800,000 doses of vaccines were donated to Paraguay, Belize, El Salvador, Honduras, and Guatemala. Speaking of economic growth, priority was given to regions and productive sectors that were dragging behind on account of the pandemic, and also the plan for recovery, strengthening the domestic market, encouraging international trade, regionalization of economic activities, and the priority setting of strategic sectors. More investment, more employment, and better commercial opportunities, with an ample participation of public sectors, private, civil society, and academic. The rise in the minimum wage was of 66% and led to a recovery of the purchasing power of 151% in the free zone north of the border and 67% in the rest of the country, which contributed to reduce by 20% the wage gap on account of gender. During the pandemic, cash transfers of the welfare programs were crucial. And annually, 100 million grants for poor family students, also apprentices, universal pension reaches more than 10 million people over the age of 65. And the fact that in 2020, the drop in family income of 6% was below to the fall in GDP confirms the efficacy of this wealth redistributive welfare policy. The Women Exports MX strategy was essential for these enterprises led by women that wish to access international markets, and the free market strategy supported the economic development of women entrepreneurs and Mexican business women. As to the prevention of pregnancy in girls and adolescents, for the first time in Mexico, it moved ahead in timely access to safe abortion with a protocol that facilitates the early and timely identification of cases of sexual violence against girls under the age of 15, adolescents, and women who result in pregnancy with hair-friendly services in terms of health care for adolescents, and the idea is to prevent adolescent pregnancies. This strengthens integral education of sexuality in the school curriculum, and which today is a constitutional right. Also, teachers in primary and secondary level are trained in this area, and campaigns are carried out through different media and that contribute to promote the sexual and reproductive rights, to eradicate child marriages early on and forced to eradicate sexual violence and ensure access to the legal and voluntary interruption of pregnancy that in the case of rape is considered as a right throughout the country, and that in the case of abortion by decision of the women has grown in the last year from 1 to 9 entities. And also the civil code was adapted to establish the minimum age for marriage, 18 years. This is a precept that prevents early unions, although it cannot end from one day to another, since this is a cultural trait that is very deep in the patriarchal culture of our people. We are working to change the image, patriarchal image, and the idea is to contain the migration. All federative entities from 2020 until the year 2070, the prospective exercise is a major challenge since the effect of the pandemic caused by the SARS-CoV virus are determinant of several social-demographic indicators. We will have to identify the areas of opportunity and cushion the effects of the pandemic and school attrition, loss of employment, and the sources of income that has mostly affected women, as well as the reconfirmation of homes on account of the loss of members.
I have to mention that the priorities of the Montevideo Consensus on Population and Development are the axis of the current population policy in Mexico. I would like to thank all the federal institutions and the organizations of the civil society for their contributions to prepare this report, and very especially the invitation to ECLAC and CELADE. And I would like to reiterate the commitment of Mexico with all this region. Thank you very much. Thank you for your intervention, representative of Mexico. We're going to continue with the Delegation of Venezuela. Thank you very much, Mr. Chair. Venezuela for decades has been and continues to be today a warm home for millions of citizens, Latin American, for the Caribbean, from Europe, from Asia, from the Arabic countries, etc. In our country, the migrants of other countries prosper. They have housing, they have health, they have all their rights, and they have no discrimination whatsoever. In the last years, we've had an increase in the migratory flows from our country to the region. So we've lost talent trained in the country, which is a valuable resource for development in other countries. Nevertheless, we have to understand that this is an atypical migratory process, extraordinary, induced due to economic problems, which is due to an aggression policy. We have a diplomacy of peace, and we condemn the criminalization of migrants and their families. We condemn the political use and securitization of human mobility. We have to point out that we estimate a high percentage of migrants that have other nationalities as country of origin. So here we have a shared responsibility between countries. We're worried, and we would like to mention xenophobia that come from the media and high-level authorities, as we expressed in the forum on migration exam or review that took place in New York. In Venezuela, we have never used this practice to advance political purposes. Migration visas that some use to obtain funds. For instance, yesterday in this room, we discussed a figure of Venezuelan migrants, and this figure was repeated today with a different value, and maybe tomorrow it would have an even more different value, but we want to repeat the migratory phenomenon makes us reject any approach that would turn migration into business. We are interested in the fact that ECLAC can carry out studies regarding the harmful effects from unilateral measures that exist in the region, and this affects the developing countries. From Venezuela, we understand the region from a systemic perspective, and we stayed fully convinced the impossibility of inclusive development in the region if we act as separate parties. Coercive unilateral measures harm the 2030 agenda, and the 4128 rule adopted by the General Assembly of the United Nations sometimes is not taken account, and it is a must for the development of the peoples. As a result of its efforts in Venezuela, many Venezuelans voluntarily come back to our country through a plan which is called Back to Your Country, and in agreement with airlines. So the pressures on Venezuelan airlines make more difficult the return. Some can't come back by land, and now they have problems with the airlines. There's no we do not have North-South cooperation. We have visa restrictions that impose restrictions to the Venezuelans that want to come back. And the Global Migration Compact, despite the fact that it is not a perfect instrument, it is very important for cooperation in this multifaceted problem. It is complex to observe this phenomenon and has to be approached in a constructive, humanist, and not reactive way in order for our countries to develop. Thank you very much. Well, we would like to thank the representative from Venezuela. We have concluded the interventions of the countries, so now we will continue with the next point in our agenda. The subsidiary bodies and intergovernmental meetings are part of ECLAC's soul, and the coordinated work are essential for the development of the region. Now, the representatives of the technical secretariats of the subsidiary bodies of ECLAC and the Forum of Latin America and the Caribbean on Sustainable Development will report on their contributions and synergies in the implementation of the Montevideo Consensus on Population and Development and in the regional follow-up of the 2030 Agenda and the complementarities with the Regional Conference on Population and Development of Latin America and the Caribbean. I invite Anna Westmouth, Chief of the Division for Gender Affairs, who will speak about the Women's Conference. 45 years of the Regional Gender Agenda were commemorated shortly ago. Mr. Carlos David Huertaya, members of the panel and colleagues at ECLAC, dear delegates, colleagues from the United Nations, representatives from women's movements, feminists, members of the civil society organizations. Thank you to all and welcome. I would like to mention, and I would like to speak about this commemoration, this gender regional agenda, a roadmap to move forward with integration, cooperation towards autonomy, towards the full guarantee of women's rights and gender equality. This is now 45 years old. Latin America and the Caribbean is the only region in the world that has this progressive, innovative, cross-cutting agenda nourished by the commitments that the governments of the region have approved in the regional conferences on women of Latin America and the Caribbean. It is also nourished by the creativity and the contributions of women's organizations and feminist organizations. And it is strengthened with the plural discussion and democratic discussion between the delegations and the countries of this subsidiary body of ECLAC, always making progress regarding the agreements adopted and with the highest standards of human rights that the region and the world have been building. ECLAC has already organized 14 regional conferences on women, the first one in 1977 in La Habana, which followed the first world meeting held in Mexico, and the last one here in Santiago in 2020. And since then, in coordination with UN Women, I would like to speak about the synergies and about the need to come together, because we are at a point where we are commemorating 25 years of the first conference, and will soon come to the 10 years of the first conference on population and development. Both conferences also brought their progress and contributed with it to the 2030 agenda. The roadmap of the regional conference on women can be seen in the Montevideo agenda for the implementation of the regional gender agenda, which was approved in the 13th Regional Conference on Women. Both Montevideo strategy and the consensus of Montevideo state a robust group of measures that guarantee equality, in fact, equality of results or substantive equality. Both share gender approaches, interculturality, intersectoral approach, life cycle, territory, and even more important than that, they coincide in what you have to do, but also on how you have to do it. And they emphasize the implementation means to build good environments and climate to advance and to promote a more present state and more financing, which both platforms need. This result also signals the importance of the institutional architecture for the advancement of women. I would like to add the synergies with the other subsidiary bodies of ECLAC that will be presenting today, and especially the agreements of the Statistical Conference of the Americas, also a subsidiary body with which we have been collaborating very closely for many years, and now we're moving towards the idea of having a comprehensive gender approach in the statistical work. These two agendas point out the roadmap to advance to the autonomy of women in all its dimension. They show us how to overcome structural differences that have become more evident and deep in the context of the pandemic and crisis. Both propose the idea of advancing several strategies, and I would like to discuss three, because we defined 10 strategic pillars in Montevideo to make progress from now to 2030 in the implementation of the regional agenda. First, to break the statistical silence. We have the opportunity, and we are working on that at ECLAC. We have the opportunity to work closer in the follow-up of equality public policies and to strengthen the different information systems like the Observatory of Gender Equality, the regional platform to follow SDGs, CEPALSTAT, and the platform that will be presented for regional follow-up of the Montevideo Consensus. Information systems is a key area to bring together both subsidiary bodies. Then I would like to speak about participation. We have heard this during these days. We have the importance of the participation of the organizations of civil society and the emphasis of the participation of women's movements and feminist movements in the subsidiary bodies. In the Regional Conference on Women, we've had the initiative that appeared in this context where not only do we have to advance, but we have to protect the progress made, and we need a regional fund for support to women and feminist movements. But so far, we have only one donor countries. So we invite all the donor countries, all the mechanisms present here to contribute to this fund, which is fundamental to support the defense of human rights in the region. And finally, the third point I would like to mention is institutionality, a more present state guaranteeing the exercise of human rights of girls and women without discrimination, and having financing for the policies in both platforms and in both agendas. We consider the importance of parity to move towards the full participation of women at all levels. Also, we have to eradicate all forms of violence and discrimination, and one we also share in collaboration with UNICEF, UNFPA, UN Women, is that we want a region free from marriage between children. Many girls are married too early, and this reality hasn't changed in the last 25 years. We're working to eliminate all the gender-based discrimination, but also discrimination based on gender identity. This is an ambitious agenda, and we have agreed regarding to it in this region. Guarantee of sexual and reproductive rights. This is also a sphere shared by both agendas and tools, and also the idea of guaranteeing collective and environmental rights, guaranteeing a sustainable production and consumption pattern, and the incorporation of the full participation of indigenous peoples and Afro-descendants in public policies. The agreements state, and I will conclude with this, the right to care in social protection systems, the development of universal care policies, and also the promotion of employment policies and special programs that will really help move forward and aimed at youth. I would like to go back to this last point because we are working systematically on this. We already have the mandate from the Regional Conference on Women, from you, countries, member of the region, where we have discussed the unsustainability of the current development model, the changes in employment, the space transformation, populational aging, unsustainable patterns of production and consumption. All this is leading to environmental crisis, humanitarian crisis endured by our region, and this is creating a greater demand of care, less time to respond to that. So we are facing a crisis of care, and we are stating from the Regional Conference on Women to move towards an elimination of inequality synergically with economic and social sides of development, supporting the sustainability of life, respecting and reorienting finances to eliminate structural differences. This is the mandate. We have political, cultural mandates, but also fiscal mandates. We need a lot of intergovernmental coordination, which is what we have in the subsidiary bodies. We have the enormous responsibility of being secretariat of them, and we need to articulate the mechanisms for the advancement of women with the sectoral ministries, with the different levels of the state, and the participation of the civil society.
That is why we want to continue speaking about these challenges, and we invite you to participate in the 15th Regional Conference on Women of Latin America and the Caribbean that will be in Argentina from November 7th to 11th in Buenos Aires, with the focus in Society of Care, Horizon for a Sustainable Recovery with Gender Equality. We are speaking about a structural change, but as always, we say the short and long term begin exactly the same day, and that is why we have called to a declaration for a change in decade. The peoples, women, populations of Latin America and the Caribbean, we are in that path, hopefully, with cooperation, integration, and solutions to this multi-dimensional crisis and unsustainable development model. Thank you. We thank Ana Westmis for her presentation on how both conferences have a dialogue. Now, Alberto Arenas, Director of the Social Development Department, to refer to the one that was held in 2021, headed by Antigua and Barbuda. Good afternoon, everyone. I would like to begin by thanking the Director of Population Division of ECLAC CELADE, Simone Cecchini, for inviting me to participate in this fourth meeting of the Regional Conference on Population and Development in Latin America and the Caribbean. Special greetings to all the authorities and delegations of Latin America and the Caribbean. In these 5 minutes, I will try to answer the question on how the regional inclusive social development can contribute to the implementation of the Montevideo Consensus, in particular Chapter 8 on the full integration of population and its dynamics in sustainable development with equality and respect for human rights. The Regional Conference on Social Development in Latin America and the Caribbean was created with a purpose to contribute to the advancement of social development policies and activities in the region. And among its objectives, there is the improvement of national social development policies, international, regional, and bilateral cooperation, exchange of experiences in social affairs, among others. And in this, we have several common denominators that are being developed in the regional conference chaired by Antigua and Barbuda on social development and the Montevideo Consensus. Different position documents of the Regional Conference on Social Development have motivated the discussion of public policies among countries that are directly connected with the challenges convening this fourth Regional Population and Development Conference, and particularly the implementation of the Montevideo Consensus. Among these documents, I would like to highlight those related to Inclusive Social Development 2015, Inequality Matrix 2016, Critical Notes of Social Inclusive Development, and 2021, in the Regional Conference chaired by Antigua and Barbuda, Disasters and Inequality in a Prolonged Crisis, towards systems of social protection, systems that are resilient and sustainable. You can check all of this online. On the Matrix on Inequality of 2016, that document is closely linked to the Montevideo Consensus. And as the document says, the Montevideo Consensus is quite a pioneer or precursor to this document. There are many common subjects, and in fact, it was one that motivated the social inclusive development agenda. In 2019, in the third Regional Conference on Social Development in Mexico City, they approved the agenda, and this is a technical and political instrument whose general objective is to support the implementation of the social dimension of the 2030 Sustainable Development Agenda, especially in those areas linked to the social development ministries, taking into account the achievements, opportunities of social inclusive development in the region. It seeks this agenda to address inequalities with a perspective of rights and includes gender equality, race, ethnia, life cycle. And it is built from an approach of universalism within the framework of the Social Development 2030 agenda. And this is very much related to the Montevideo Consensus. Both instruments highlight the centrality of the objective to eradicate poverty and break the cycles of exclusion and inequality. The Regional Social Inclusive Development contains 56 lines of action and has 4 axes of central policies. First, universal integral social protection system for eradicating poverty and inequality. Second, policies of social and labor inclusion. Third, not leaving anyone behind. Strengthened social institutions so as to implement quality social policies. And the first axis of social protection has become key to achieve sustainable development with equality. In the pandemic, advocating for its universality, resilience, sustainability, more necessary than ever in the present context. Its implementation will allow to break the cycles of exclusion and inequality that in the Montevideo Consensus, it says it is a condition for the development of the region. The last two axes are strengthened social institutions and strengthened regional cooperation. And this together with collaboration, multilateral coordination, and strengthening or having the necessary resources to give sustainability to the social policy and support the strategies. And I would like to highlight two messages. First, without social inclusive development, it's not possible to reach sustainable development. And the second issue, for sustainable development strategies to be feasible, you need to face inequality in the region. The Montevideo Consensus and Regional Agenda of Social Inclusive Development substantively support this advancement and to face inequality, which is an obstacle for sustainable development, and thus to move forward in fiscal and social pacts guaranteeing financial sustainability of social protection system. And all of this is essential. In this context, the approaches of rights and equality are the main foundations of Montevideo Consensus and the Regional Agenda of Social Inclusive Development, and they are the basis for a new development sustainable model proposed by ECLAC. At times of regional and world uncertainty, with a pandemic that unfortunately continues in the region for third consecutive year, with a demographic transition, accelerated aging, technological and climate changes that converge in social unrest. Well, an inclusive social development is an ally to meet the challenges and expand opportunities in the region. We thank the intervention of Alberto Arenas. Now it is the time for the presentation of the Statistical Conference of the Americas by Mr. Rolando Campos, Director of the Division. Thank you, Mr. Chairman. I greet all the representatives of the countries with us today in this fourth meeting of the Regional Population and Development Conference of Latin America and the Caribbean. I also greet the director of ECLAC, Simone Cicchini, and his team, and congratulations for this excellent coordination for this process. I will now refer to the question raised within the framework of this conference, and that is, how could you strengthen the synergies of the Statistical Conference of the Americas and the Population and Development Conference in order to improve the population data, administrative records, vital statistics, and according to 102 and 104 priority measures of Chapter J of the Montevideo Consensus. We call that Measure 102. It regards the improvement of data sources, vital statistics, specialized surveys, promoting the full independence of systems, national statistical systems, and this is very important, promoting the full independence of national statistical systems. Measure 104 was to promote coordination among the national statistical offices and in order to improve statistical administrative records coming from the sector. I want to mention that as technical secretary of the Statistical Conference of the Americas, chaired now by Argentina, We, from the conference, we have a natural synergy with the Regional Conference on Population and Development. The Montevideo Consensus has the commitment to improve data sources and move forward in statistical development, and these are common objectives with the Statistical Conference of the Americas. In addition to that, the conference has the participation of several national statistical offices here present, particularly 3 of them. We have Dominican Republic, Colombia, and our colleague from Venezuela.
And different works that we are undertaking in the framework of the Statistic Conference of the Americas deal with these topics that are being proposed, and I'm going to refer only to 3 of them. And the first one relates to a decision made by the past conference in which they created a community of practice on population census. This community, launched in recent May, promotes discussion and exchange of experiences between the countries of the region, especially on the implementation of censuses. Since, as was mentioned, and because of the pandemics, many countries have delayed the gathering of data for census, and many are doing this year, 2022, like Argentina in May. Ecuador will be conducting the census in next October, and for 2023, colleagues of countries of the Caribbean are also ready to launch a population census in this year, 2022. Some will do it in 2023, such Antigua and Barbuda that we just commented. So within the framework, the work of the knowledge transmission network that is being managed thanks to the unwavering support of INE from Chile and CELADE that help in the coordination. We are making presentation works, dissemination, good practices by using all the comparative advantages that we could have during the pandemics, which is the case of Mexico, where during the pandemic they have to apply the census. We hope that this community will not only become a useful space to reinforce regional progress in census, but also can be a successful pilot experience for the rising of new community for issues of interest for all. A second point is that in the groups that were approved in the Statistic Conference of the America 22-23, 2 were included, dealing with administrative records reinforcement. The first one developing a tool to assess the quality of records, while the second one analyzes the possibility of integrating administrative records coming from different sources to produce information on childhood and adolescence, topics that directly relate with this conference of today. A third work group is directly centered in priority measure 104, which is enhancing cooperation between national statistic bureaus and the relevant authorities in the statistic domain, which are generating guidelines for interpretation and application of a concept that in the Statistic Commission was created. The concept data stewardship in our region. It only relates in how can we improve, manage, and how can we have guidelines for statistic building of administrative records that we already have in our countries. It looks for reinforcement the role of national statistic bureaus to build an official statistic coordinator for coordination in each one of the country by including other public and also private bodies. This to generate more streamlined statistic laws. And finally, there's one aspect in which I feel that it should be and is specific, both of the three bodies and also of this conference I just referred to, that meaning going beyond statistical arena, we need to take the priorities or statistic development to other fields of other players in the governmental field, the politics. We need to have more and better data. And one problem is the limitation to access of administrative registry, and and how information is organized and generated, and how national statistic bureaus should coordinate among themselves and should allow access. They should be the link, the liaison to generate and improve statistical registration. This very valuable information would allow all of us to improve coverage of statistic, but this is not taken advantage of today because some laws are incompatible and some institutions are jealous of information. So we need to generate awareness that better access to this information by statistical bureaus will benefit all stakeholders, because not only they allow us to generate new statistics, but the process can improve the quality of registration and records and the way how institutions gather the information. Let me remind you that everything happens in one place and everything can be georeferenced, and linking statistical information with geographical or geospatial information is critical. This actor, we are pressing for this since from the Statistical Conference of America with SELADE through the CEPAL-STAT platform, in which we are georeferencing all census information to make available to all countries in the region all the aggregated information that we have with information, so you can view it and link and mix this information with other information, economic information, environmental information, geographic, territorial information, and all this de-aggregated information. So we look forward that ending this conference, we will be able to work in these topics, and we have a more open region and moving ahead and make it as those who preceded me have already commented. Thank you very much. We thank Mr. Rolando Campo, representing the Statistical Conference of the Americas of ICLAC. And at the end of the round of interaction, I have the pleasure of presenting Luis Yañez, Secretary of the Commission, who, in addition of being responsible of all Secretariat of subsidiary agency, is presenting in this forum the meeting at the regional level after Agenda 2030 that will held in San Jose in the month of March, marking the return to face-to-face meeting. Thank you, Mr. President. My general reflection on thoughts. The question about synergies emanates from the Montevideo Consensus and a decision that was taken on Lima under the chair of 2018. And these are the things that arrive in ICLAC. The director of SELADE makes the hard question to our other directors if we have been able to move forward subsidiary agency towards this pathway. And there are characteristics shared by subsidiary agencies that are called the attention because they are consistent with the movement at ICLAC. And the first characteristic is that all these meetings are not organized exclusively by ICLAC. We have one strong partner in the national system. In the case of population, we have UNFPA and team that are deployed since the beginning of the conference. The Conference of Women Conference is associated with women's on mujeres, and together with the International Agency of the United Nations system to add synergy, not inside but also outside ICLAC. Social Development Conference is organized with the UNPD, and we add contributions and different views. There is a committee of the Statistic Conference that continues to accompany the process, and I think that is an essential characteristic which shows consistency and coherence inside and outside ICLAC. Another very important thing, and I see Juan Daniel is the chair. In all these subsidiary agencies have a chair, the importance of countries' leadership with the accompaniment of ICLAC. I say Juan Daniel, I don't know if he enjoyed or suffered being the chair of CEA, that it was a continuous conversation. And David, I'm telling you, that will be the case. The Secretariat accompanies and goes with the government and the presiding officers all throughout the years of the meetings. This is essential. We do not abandon we do not quit the process. These agencies are alive and they act and operate. Another element deals with this permanent conversation with government and players of the United Nations system and the civil society. We permeate, we talk, we are impacted by proposals, concerns, and ambitions. Then many times we in the United Nations, we do not see, so we need these voices and views when making mistakes and progress. We have learned to listen to each other, and we pass it from two monologues, we do not make up a dialogue, to holding complex, difficult conversation between the different actors that accompany ICLAC structure. What's missing? Maybe we still miss the final mile, the final meters. All these intergovernmental meetings have a regional agenda that was approved by government, Montevideo Consensus, Montevideo Agenda, Inclusive Social Development Agenda, which is the link between regional and global, Cairo, Copenhagen, and Beijing. We still are missing the final mile, how Montevideo strategy, Montevideo Consensus, Inclusive Regional Agenda is incorporated at the national level to the United Nations system. Essential for that are resident coordinator, and for every year we have Igor. He's the resident coordinator of Peru. He is not here today with us, but the idea is how we make our own the regional consensus to facilitate each one of the country the implementation and the support from the United Nations system that negotiate cooperation agreement with the countries every 2 or 4 years. And this regional consensus that have this strength, they have a matrix and an implementation and enforcement of the Agenda 2030 should also gradually be incorporated to those processes. What happened on the forum of sustainable development gathers all these characteristics. We have all the United Nations systems. We are always accompanied by the Deputy Secretary General, all resident coordinator, all agencies and all countries that put in place the Agenda 2030. And we recall, we mention the progress made in the Montevideo Consensus, the progress made in inclusive social development and the importance of data. Without this tool, we will not be able to make any progress. This is the formula that the ICLAC Secretariat and all divisions try and be consistent in moving forward the region towards the implementation of the Agenda 2030, and in this particular case, the application of the Montevideo Consensus. Thank you very much, Mr. President.
Muchas gracias, Luis Yáñez, secretario de la Comisión, por esta.
I thank you for your work to support participation by the government. Once again, with the collaboration of the Secretary, you will now have time for statements by the delegations on this matter. We will move on to the statement by the Dominican Republic. Yes, thank you very much, Chairman, and thank you the various directors who have presented the work done among all bodies and conferences. I, as the representative of the Dominican Republic and with experience as someone who came from UN Women and is today working in a National Statistical Office, I can confirm the joint work that is done. Now, resuming my role as delegate, and speaking on behalf of the Dominican Republic, I would like to highlight the progress necessary for this coordination. This has to do with planning. If there is no coherent planning aligned by countries, it is difficult to achieve the complementation that must occur among all instances. And so I would like to highlight that the government of the Dominican Republic, since the arrival of new authorities in August 2020, we began working to provide a correlation, not only of international instruments, but the national planning instruments. With our main banner is a national strategy for development of the Dominican Republic. We began with a process of aligning and putting in motion the national strategy that has a 2030 approach aligned with these SDGs and resumes the Montevideo Consensus. And with this plan, we make it operational with what we call our national pluriannual plan for the public sector. This plan, we've worked on it with 32 priority policies. One of these is the policy on data management for the analysis of decision-making. What it seeks is, above all, to implement public policies based on evidence. And among the outputs given priority to by the plan, pluriannual plan, is the holding of the 10th National Population and Housing Census, a public investment project of the country to strengthen household surveys, the economic surveys, and as indicated by our director of the statistical division, all the administrative records, both in the area of economics, social matters, and infrastructure and others. Also, regarding the planning, the pluriannual plan has also aligned our strategic plans, but also the national statistical plans. Yesterday, we distributed for the first time the methodology for the statistical plans, and also by the month of October, we will be publishing our national statistical plan in line with the National Development Plan. And our strategic institutional plan ensures the quality, and with to be in line with the statistical division of ECLAC, we've been working on the quality of statistics so that we can have official data that we can count on. Another topic that we have proposed is to increase our wealth of information. So with the gender division, we're being supported by ECLAC with regard to the strengthening of capacities to have gender statistics, and are coached to make the most of the module of care in our 2021 household surveys and the formulation of time use survey in 2023. And last, I would like to speak about the National Census of Population and Housing that will be held this year in November, and for which we've received essential support by UNFPA and the work for very fundamental themes of the consensus of Montevideo. As I said yesterday, the inclusion of the equiracial variable, the Washington Group, issues on disability, but also a reduction of the age at which we ask about the first pregnancy, which used to be at 15, and now we've dropped it to 12 on account of working there together with CELADE. Significant coaching was done there in order to fine tune all these demographic themes and how we ask the questions. And with regard to the law, I think that just with El Salvador, we're only two countries of Latin America that still have old legislations. The Dominican Republic goes back to 1959. However, there is a proposal already. Well, in fact, three proposals, but we, our National Statistical Office, were supporting Senator Racilo Rahul and Franklin Rodriguez to present a proposal in line with the framework that was adopted within the UN for the general law, and that we are moving ahead with this, and also using the central bank as a fairly relevant organization for the development of national statistical systems in the Dominican Republic. Thank you very much. Well, we thank the representative of the Dominican Republic for her statement, and I will now move on to the representative of Cuba. Thank you, Chairman, and we would like to thank the directors for the statements made and all the useful information that has been passed on, and also the recent visit by Rolando Campos to Cuba in regard to statistics that was very useful, and also the other visit by the regional director of UNFPA, Mr. Robinson, which was very useful and contributed so many elements for the work that we are carrying out in the country on these themes. Within the current context of general crisis and the each time more complex international scenario, we believe that achieving the maximum coordination between different instances and making the most of the available resources, as well as the work based on outcomes that considers past experience, is essential. And hence the relevance of sharing information that's relevant, such as the one that was presented here by the directors, among the various actors that have a role for sustainable development and that goes far beyond the national governments. And on account of this, we are very grateful to the organizers of this space and the fourth session of this regional conference for the exchange of successful experiences and good practices, which helps us to find solutions to similar solutions or that could not be addressed in isolation and that requires of international solidarity, cooperation, including South-South and triangular cooperation from a multilateral approach. As always also was said by Mr. Yanez, the fifth forum of the countries of Latin America and the Caribbean on sustainable development, I believe, served us all for these purposes, same as to follow up on the implementation of the 2030 agenda, and especially some sustainable development goals that are key to population and development, such as SDG 4 and 5 that yesterday was explained by the director. Furthermore, the conclusions and recommendations of the regional forum, we believe, will be very important to be considered for the high-level political forum for sustainable development to be held from the 5th to the 15th of July next in the UN office in New York. And dear delegates, I would like to highlight in this space that the government of Cuba pays special attention to the issues related to population and development, so much so that national follow-up is done by the Prime Minister of the Republic and two Prime Ministers. We are very advanced with a major population aging, low levels of fertility, low levels of child mortality, and high life expectancy. This reality presupposes special challenges for the development of the country that will have to consider a substantive reduction of the labor force, the trend towards growth of vulnerable population groups, and the overburdening of young people with responsibilities. So, we will move towards a caring society, which will a national priority. And in this sense, and additionally to the information given yesterday by the Minister of Foreign Trade and Foreign Investment, the country is furthering significant processes such as the formulation, people's consultation, and soon approval in October 2022 of the draft code for families that will regulate significant components of the rights of different types of families in Cuba, the protections of girls and boys, adolescents, women, and the elderly, and persons with different sexual orientation, territorial origin, and other components that make it one of the most advanced internationally. Mr. Chair, we thank you for the space given to us, and we are at the service of the conference and the presidency to work together for compliance with the Montevideo Consensus and the Cairo Action Plan. We are attentive to the holding of the coming 20 and 30, 10, 15 years respectively. Thank you. Well, we thank the representative of the Delegation of Cuba and now continue with the Delegation of Colombia.
Muchas gracias, señor presidente.
Thank you, Chairman. And in Colombia, special greetings to Ana Guesmes and our dear friends Rolando, Luis, and Alberto Arenas, Director of the Social Development Division. And first of all, we wanted to congratulate you for these statements that motivate and interdisciplinary dialogue around all these themes covered by the Economic Commission for Latin America and the Caribbean, and where I believe that this interdisciplinarity becomes extremely relevant in order to achieve a significant advancement of the agenda for the Montevideo Consensus. Once again, our greetings to the representatives of the various UN bodies and agencies, and members of the national delegations and civil society organizations, academia, and international cooperation agencies that are with us right now, because for us this is extremely valuable. In particular, from Colombia, the agenda on population and development is considered as a multidimensional agenda, as spoken in the Montevideo Consensus, not only because of its nature, but because it involves different actors and sectors of our society. And in that sense, it is necessary to maintain activities that are interdisciplinary and that involve, in a connected fashion, other subsidiary bodies of ECLAC and the Forum of the Countries of Latin America and the Caribbean on Sustainable Development, such as the Statistical Conference of the Americas, the Conference on Science and Information and Communication Technology, the Conference on Women in Latin America and the Caribbean, the Regional Conference on Social Development in Latin America and the Caribbean, the Regional Intergovernmental Conference on Aging and the Rights of Older Persons, and the Ministerial Conference on the Information Society in the region of Latin America and Caribbean. And likewise, in Colombia, we consider that given the cross-cutting nature of the themes of these bodies, such as the Regional Conference on South-South Cooperation for Latin America and the Caribbean and the Committee on Development and Cooperation of the Caribbean, it is possible to continue developing space for the exchange of information and knowledge regarding the best practices in each country in order to move ahead with the compliance of the Montevideo Consensus, as we've heard, based on the statements heard today. Just to give an example, we think that in Colombia, we have many elements that we can contribute to the advances reached in order to comply with the commitments taken on, not only with regard to the Montevideo Consensus, but the Nairobi Summit and International Conference on Population and Development. Currently, in Colombia, we have interinstitutional instances based on which we draft a population analysis considering variables such as risk management and health, as well as the migration population and population dynamics, all based on statistical information and the very valuable administrative records that Rolando Ocampo mentioned. Likewise, we do highlight with this regard the role played in the specific case of Colombia, and that we would like to take this space to thank you and highlight the work done by the UN Population Fund and the office in Colombia, who have contributed to strengthening national coordination in this regard, and that thanks to the support as well as the leadership by the statistical office in Colombia, we are closer to formalizing the mechanism and having a interinstitutional commission for population and development that is the guiding entity of all these policies that in a way make up the commitments based on the Montevideo consensus and public policy of the state of Colombia. Likewise, we would like to share and highlight and make a place at the service of all other members of the conference that we have seen important progress in terms of making visible and the public policies favoring population groups that are usually subject to discrimination, such as women, persons with disability, migrant population, lesbian population, gay, sexual, transsexual, and other population groups, particular to the case of Colombia, such as the peasant population. We would also like to highlight the progress or the outcomes reached with regard to the cross-cutting nature of the intersectional statistical production, as well as the making visible the various population groups, highlighting the relevance of having mechanisms to strengthen statistical culture in our countries. In fact, yes, as was discussed very times in the Statistical Conference of the America, the data that's not used are those that are not useful.
Likewise, from Colombia, we recognize that the role of the national statistic offices becomes a referent, as our colleague from Dominican Republic said, a referent to establish governance institutions for data that go beyond the official statistics and that favor the contribution of stakeholders, not only from the private sector, but also from organizations of the civil society and the academic world. We are just about to open the voluntary registration of sexual diversity and gender identity as a mechanism of collaborative statistics for the lesbian, gay, intersexual population, etc., in the framework of statistical work, for them to be able to report their socioeconomic situation. And we would like to extend that to the other populational groups that have been traditionally discriminated in Colombia. From the Statistic Office, we have wanted to recognize more than ever the need to advance in things that allow us to leave no one behind. In the statistic world, we must always be engaged with measuring that we value the most, like all these commitments that we have in the Montevideo Consensus. And finally, regarding the comment of our dear friend Luis Yanez, I would like to mention, Mr. Chair, that the support of ECLAC as technical secretariat is the engine to make progress, and the will of the chair and the experience we had with the Statistical Conference of the Americas. These things are the basis for efficient innovation, coordinated innovation, and this is what will help us comply with our commitments with our society, like what we have in the Montevideo Consensus. Thank you very much. Thank you very much, representative of the Delegation of Colombia. We continue with the Delegation of Suriname.
Thank you, Mr. President. Distinguished delegates, representative of the United Nations systems, members of civil society, ladies and gentlemen, good afternoon. Mr. President, as of March 2020, our government was forced to take drastic measures to prevent the further spreading of COVID-19. Since then, our lives have undergone drastic changes. There is no doubt that these measures have saved the lives of many. Some of the downsides, however, have been the increase in unemployment and domestic violence. Within the framework of the Engender Project, the government of Suriname took actions to strengthen the system that deals with domestic violence. A referral pathway was designed and made available to the various aid organizations in order for them to respond more efficiently. In addition, the project also produced awareness material that was broadcasted throughout different media platforms. In order to provide support to people who have been financially affected by the COVID-19 pandemic, the government established a COVID-19 emergency fund. This fund is intended to provide financial support to people who experience the loss of income as a result of the COVID-19 pandemic. The school closures caused by COVID-19 have brought significant disruptions to education across the country. Given the abruptness of the situation, teachers and administrations were unprepared for this transition and were forced to build emergency remote learning systems almost immediately. One of the limitations of remote learning is the lack of personal interaction between the teacher and student. Another challenge in organizing remote education was the lack of adequate digital infrastructure. The pandemic gave rise to learning losses and increased inequality. This inequality was recently exacerbated when we had closed schools in several areas due to excessive rainfall. To reduce and reverse the long-term negative effects, the government needs to implement learning recovery programs, protect educational budgets, and prepare for future shocks by building back better. The COVID-19 pandemic is not only an attack on our health. The healthcare system and health professionals unprepared for a health crisis of this magnitude have suffered greatly. The nursing staffs in hospitals, and care providers are mostly women. They are on the front line of medical physical care with all the possible risk of contamination that entails. However exhausting with hard work, the help of friendly nations, the enthusiasm of the care staff, and improvisation, the number of deaths has been kept relatively low. The COVID-19 pandemic made it clear that we need to invest in national health systems that are universal, resilient, data-driven, and adequately staffed. On the other hand, little attention has been paid to the mental damage caused by COVID-19. The socio-economic disruption is great. People have lost their jobs, were forced to close their businesses, have lost loved ones, and young people who no longer had recreational opportunities, among other things. Many men and women working in the informal sector have lost their jobs and income. They could not make use of the emergency aid that had been set up for this purpose because they could not prove the loss of employment. According to the Planning Office, the GDP dropped by 13.5% in 2020. Suriname faces major challenges, not only because of the consequences of COVID-19. We are dealing with financial deficits, high debt, and low international reserves. We are well aware that it is not an easy task to get out of this deplorable situation, and yet we will solve these problems and not give up. On May 10, 2022, the government of Suriname launched its National Population Policy 2021-2040. The population policy provides insight into the demographic developments of the country that are important for economic growth. It is founded on a sustainable integral development vision that includes the perspectives of human rights, gender equality, and climate change. Together with the various national documents, the population policy provides guidelines for sustainable development. Mr. President, complex problems require complex interdependent solutions. Diversifying our economy is one of them. Suriname is rich in resources that have not been sufficiently exploited in the past. Of recent date are the oil discoveries along the Surinamese coastline that have the potential to increase Suriname's financial income in the near future. We see the recovery from COVID-19 and the recovery of our economy as an opportunity to tackle structural inequalities and build an inclusive society where no one is left behind. The government of Suriname expresses its sincere acknowledgement to our partners within the United Nations system who continuously support us in the process of achieving sustainable development. Going forward, Our government will continue to work on further implementation of the 2030 Agenda for Sustainable Development, paying special attention to our national priorities as laid down in the National Development Plan. In closing, we would like to reiterate that it is critical that we continue in the spirit of the ICPD and therefore strongly reaffirm our political will to the objectives of the program of action of the ICPD. Thank you.
We thank the representative of the delegation of Suriname. We continue with the delegation of Guatemala. Thank you, Chair. I would like to greet all the members of UNFPA, ECLAC, CELADE, the different member states that are here today in this fourth meeting of the Regional Conference on Population and Development of Latin America and the Caribbean. In the first place, I would like to celebrate that complementarity framework, that multi, transdisciplinary, which allows us to accompany the sociologic and political axis of the Montevideo Consensus and Cairo +20. We're coming close to the 10 years since the consensus, and we've been accompanied by the United Nations system, especially ECLAC Mexico, in the formulation of public policies to develop an inclusive development. So we need a quantitative understanding to then move to the qualitative framework and strategic framework that I will mention as challenges to strengthen the synergies and strategic alliances. In the case of Guatemala, social, civil society, etc., and financial cooperation from the international agencies. I would like to go back to what Alberto Arenas has said, Director of the Division of Social Development, regarding that framework to attain an inclusive economic development. The government of Guatemala has ratified some things on how we have articulated civil services, bureaucracy, budget, legislation, but basically public policy. Our first issue has to do with the strengthening of the fund for micro and small enterprise with $50 million to help over 50,000 persons trying to generate decent employment. And we're working together with the Ministry of Labor and Social Security to guarantee our commitments, our engagement with ILO, and be able to provide public goods and others to have decent work. During the framework of the pandemic, how we articulate state banks, especially national mortgage credit with an investment of $40 million to take care of families that are enduring emergencies and economic problems, for them to be able to face the crisis due to unemployment, inequality, but basically building bridges with the private sector and try to generate decent work, promotion of exports, competitiveness, and the closure of the digital divide. Today, we framework the democratization in the management of knowledge. This holistic approach allow us to make more democratic these good practices. In the case of Guatemala, this includes the coverage of programs for the older persons. We understand the logic of the aging of population in Guatemala and the challenges this implies, how to recover the demographic bonus to generate greater employability, but basically to advance in the social inclusion of the youth, women, indigenous peoples, disabled persons, etc., for them to have quality goods. When we speak about social development in Guatemala, we speak about health, education, food safety, employment as an economic category, but especially water, sanitation, adaptation, and mitigation of the climate change. children and women are the most affected persons. And in the case of Guatemala, we have food supplies. That is, we give children the micronutrients, the grains they need to then have quality education. And so we have allocated over $90 million to help more than 4.3 million children in their infancy to guarantee the human right to education. Then we have social protection, and especially the fund for employment. Here we are speaking about over $95 million with an execution of 75%, precisely to favor the value chains, entrepreneurship, and the White Seal program with from the Ministry of Economy to take care of juvenile jobs, women's jobs, and farmers and peasants of the highlands to guarantee that they have the necessary seeds and can make the lands productive. Then we have a credit for capital work, and in this case we have benefited over 800,000 families to create the socioeconomic conditions that allow to find a balance vis-a-vis the global wave of unemployment. The last part I would like to mention is the level of universalization that we have had for public health, especially reducing maternal and children mortality rates. So this needs or implies challenges in public policies. We need to act in a different way. The Guatemalan conference has different challenges. We need to connect public policies. We have intersectorial problems. We have to include the social work, and we have to articulate those foreign policy actions and then materialize that in development. Guatemala today goes to the forum in New York on sustainable development, and we will present 325 municipalities that have plans for territorial regularization, and also regarding the use of time, of leisure time. These things are key for the Guatemalan government. Which are the contributions from the subsidiary bodies? Well, knowledge management is applicable in practical policy. It allows to adjust guidelines, laws, public policy that allows us to generate good living conditions, and we place the citizen at the center of the sustainable development. So we work with the international humanitarian law and national too, but in the framework of Guatemala, we adopt economic commitments like in Cairo +20, and we also generate a framework of co-responsibility of other types of stakeholders. We have the private sector, the civil society, international cooperation. We need a strategic planning. We do it through the planning office of the presidency, and we have adopted a declaration called Transforming the World in agreement with the SDGs. We have taken the 17 targets of the SDGs and we have articulated that with our development plan. And this has allowed us little by little to make progress in the implementation of social programs to reduce the poverty gaps, extreme poverty gaps, and put an end to social political differences and try to generate the conditions for a more active participation of women in the labor market, in the political grounds. As Guatemala, we believe that this is a space to discuss our progress and also to speak about how much we need to have good statistical offices. We have talked a lot with INEGI to have the third population census, the survey on life quality, household income surveys, and this will allow us to know how the people in Guatemala spend their money and how this is having an impact in the reduction of the remittances. So we thank you. We reiterate our commitment to advance in legislation, public policy, budget, etc., in everything that has to do with sustainable development, where population and development, of course, are strategical categories for social and economic prosperity. Thank you very much. We thank the representative from Guatemala. We continue with the delegation of Granada.
Good afternoon, everyone. On behalf of the government of Grenada, the Minister of the Ministry of Social Development, Housing, and Community Empowerment, I bring you esteemed greetings. The government of Grenada over the years have worked assiduously to put Grenada on a sustainable development solid foundation. We acknowledge that while there has been progress, there has also been a somewhat slow implementation of actions that are aligned to compliance with stated goals. As a small island developing state located in the Eastern Caribbean, we are prone to experiences of climatic hazards, and with the onset of the global pandemic, Grenada's limited human, technical, and financial resources were critically impacted. Nonetheless, Grenada's strategy for pressing forward was the formulation of the Sustainable Development Plan that was aligned to the SDGs and was practical in operationalization. The National Sustainable Development Plan is the anchor for Grenada's development agenda and priorities for the period 2020 to 2035. They also focused on improving the policy architecture that is what we will be governed under for the next period of 2020 to 25. The policy architecture speaks to the disability policy and strategic action plans, the essential services packages which we have engaged in, the aging policy, to name a few, and the National Disability Policy and Action Plan. And we have other policies and legislations that are being put in place to improve the architecture for social development and social protection. In terms of how do we use evidence, there was a hiccup when we were on lockdown with the proceeding with the household census, as well as our poverty assessment. However, we have found creative ways to continue with the household census using the remote access in the first instance before we were able to resume doing the face-to-face assessment. And we used the same technique to continue with the poverty assessment, the participatory poverty assessment. Now, we would have had no choice but to strengthen our social protection mechanisms as a result of COVID-19, because this was the good thing about COVID-19, and yes, I did say the good thing. It exposed some of the gaps and gave us opportunities for improvements in areas that we were complacent or not acknowledging that we needed to address, right? We were able to work with our developmental partners, which was key for how we would have proceeded. So we worked with our developmental partners, the UNFPA, PAHO, CDB, UN Women, FAO, UNDP, and OECS, and the government, other regional corporations within our OECS region. We were able to work alongside those bodies to come up with a suite of social protection packages which we required to move forward. That included providing protection for the vulnerable populations in the informal sectors. And in the informal sectors, what we saw happening, that would be primarily our women who were engaged in care work as domestic workers, for the stay-at-home parents, for unemployed youth, even for our migrant workers whose employment was not formalized before the COVID-19 set in. We also offered to our population the COVID-19 emergency response income support for catering again for those vulnerable populations, including those airline workers, taxi drivers, retail workers, tour guides, because no income, they needed to have some form of income to take care of themselves and their households. Some of these payments are ongoing. It still is in existence, though we have started opening back up and moving forward. Okay, you had unemployment benefits that was paid. Also for persons who were in the formal sectors, what we saw happening is that some of the formal sector employees were also unemployed, temporarily unemployed. And based on that, what we had happening is opportunities for retraining and redeploying them in more critical areas needed in that sphere at that time. So we are really happy that we were able to do that. And we are seeing the benefits of that to this day, because we have some more entrepreneurs, youth entrepreneurs coming out of the training operations that would have taken place. The Engender project has been critical to us, as has been the Spotlight Initiative project, because through those two mechanisms, we were able to get short-term and medium-term and long-term support for social protection systems. And in the Spotlight Initiative project, what we have is a combination of UN Women, UNDP, PAHO, UNFPA, a number of players that are collaborating together with us to implement and to make sure that we work on addressing our gender-based violence issues, the structures to address gender-based violence in all its forms, and to make sure that we have that level of reduction of and improvement of services that are aligned under our agenda, which is the eradication of gender-based violence. Now this, as I would have identified before, this was not without challenges, and the reality is this pandemic caught us, like the rest of the world, on we were there trying to put ourselves on a solid footing. And here it is, we are experiencing a shock that it is beyond our ken, that we have never experienced. How do you deal with this to prevent long-term effects? And we have the psychological effects that we have to think of. We have the economic effects, the health effects, the comorbidity, the morbidity factors we need to take care of. And the human rights component also needs to be very much in place when we are looking at how we implement our actions. So we had a massive vaccination campaign, and it is still ongoing because we still need to have people vaccinated. But there was so much negative pushback that it still needs to go on. People still need to be aware of why we need to be vaccinated. If we want to resume some level of normalcy to move forward, we need to look at vaccination, but at the same time, we do not want to infringe on people's rights to not take the vaccine. So we are working that delicate balance of how do we do that. Our healthcare system definitely needs that kind of support in terms of the human, the technical resources, the medical equipment and what have you. We do need that kind of support. There's no denying that. In terms of how we see the informal sector workers, they are seriously impacted. The informal sector would be our women who are doing the little hustles inside. They are seriously impacted because we are now moving back forward. So like, let's say the hairdressers and what have you, who are trying to run their own businesses, it was shut down during that period, and they are now trying to recoup. Some of them cannot recoup because they still have other impacts. They had to become teachers, de facto teachers for their children, whilst the schools were in shutdown. So they had to take up that mantle of taking care of everything and ensuring their children's education. So we still need some work there to help support these very vulnerable persons. Our women and children who were in households of gender-based violence, they continue to be exposed, and it was exacerbated during the period of lockdown. And we are now having even more reporting, but we have that level of threat that they still experience because their perpetrator is very closely monitoring and totally on top of what is happening with their partners, the victims. So we still are working very hard to ensure that we take women out of that vicious cycle. We put them into protective care at our Cedars homes to ensure that we are not going to leave them behind. We have to keep them going, and we are doing empowering programs to build the victims up as we move forward. So in terms of data, one of the things that we need to have definitely on the table is that we will need to have gender responsive budgeting, and we need to have our data systematically collected and segregated along the indicators so that we can build our evidence-based programming and move towards optimum utilization of limited financial, technical, and human resources. So as we move forward, I thank you for the opportunity to share what we have been doing. I look forward to some new innovations because we've started the discussion with UNFPA with regards to the population, doing a population policy, and this is going to be fantastic as we move forward. So thank you so much for hearing us, and look forward to continued collaborations with the key partners.
Agradecemos.
Well, we thank the representative of the Delegation of Grenada and now continue with the Delegation of St. Vincent and the Grenadines.
Good afternoon to the President, delegates, civil society organizations. A pleasant good afternoon. St. Vincent and the Grenadines, for those who don't know, are part of the Eastern Caribbean area with 32 islands, of which 9 are inhabitable. And because of those geographical differences in space, it comes with its own suite of challenges because of the physical infrastructure that is separated. Hence the reason we are called St. Vincent and the Grenadines. We are, on behalf of the government of St. Vincent and the Grenadines, via the Ministry of National Mobilization and Social Development, of which I represent today, we would like to say a heartfelt thank you to this conference, and also to not just all delegates, but I want to say a heartfelt thank you to the panel of directors who were able to provide the presentations that was recently presented. In the context of St. Vincent and the Grenadines, when we look at the Montevideo Consensus and the impact, first of all, the impact of COVID-19, which is the socioeconomic impact, we must look at, and it was significant, it really drew my attention when the chief of the statistics division on the panel would have asked a very important question or made a strong comment stating that we need to still provide substantial evidence on the capacity of nations to implement the Montevideo Consensus and show the solidarity with the UN framework and create synergies with subsidiary bodies of ECLAC. How do we get to that point is a question, because it is easy for us to be here and we are making the presentations of the efforts made, but until we create a marriage between what we are doing at the national level and what we are all endorsing at the level of the Montevideo Consensus, can we truly show efforts at implementation and our capacity, and where there is need for support from the very same subsidiary bodies of ECLAC and other regional entities. In terms of the impact and its marriage with the Montevideo Consensus, when it comes to poverty, hunger, and inequality, in terms of St. Vincent and the Grenadines in 2020, like any other territory within the Eastern Caribbean area, in 2020, we would have, the government of St. Vincent and the Grenadines would have created a national strategy called the Shock Responsive Social Protection Strategy, where we were able to re-engineer our social protection infrastructure and create new grants for beneficiaries who would be impacted by the COVID-19 pandemic. It created a suite of packages that were provided not just for existing vulnerable populations, but the additional or new populations that would now be deemed vulnerable because of the pandemic. Persons who would have lost their jobs would not have been below the poverty line before the pandemic, but they became a new statistic and a new reference point to warrant a national review of its social protection landscape, and that we did. We also looked at the need for increasing food security stabilization and reducing our national import food bill. This is also a growing requirement within the Eastern Caribbean area by one of our regional bodies called CARICOM. In addition, we also had, if we look at the landscape of how COVID-19 affected health and wellness in St. Vincent and the Grenadines, 8.2% of the population, we are a population of 110,000 across the 9 islands that are inhabited. 8.2% of the population was affected in terms of contracted the COVID-19 virus. We had 0.1% of the population where there were deaths due to the pandemic. And in terms of our vaccination status, as far as the deaths are concerned, we had 103 of the persons who died that were unvaccinated, as opposed to 8 of the persons who died that were vaccinated. The total vaccination rate of the country is at 28.1% of the population, just like in other territories like Grenada, that would have just presented, and like Jamaica, who would have presented earlier, that spoke of the resistance when it comes to vaccination. We would have also gone the route of looking at adopting public health legislation that promoted the vaccination as a requirement for frontline workers, etc. So even that would have come with certain levels of resistance. And as Grenada delegate would have pointed out, how do we balance a public health requirement against the human rights being infringed upon, and also looking at the impact of social change in the lives of people and behavioral changes that would occur? Because those who are resisting, there are some who have valid reasons why they are resisting, and we have to communicate effectively in order to create that great exchange amongst the population. Otherwise, we lose the people and we lose their trust and confidence in the system and the people who are charged with the responsibility to protect, support, rehabilitate, and develop the population. So what we have also looked at is with regards to loss of learning. We would have dealt with the procurement of 30,000 tablets so that students across the country, we were not a country that was shut down like other territories. We never shut down our borders. But in terms of the school or the learning population, they would have stayed indoors for the majority of the period of the pandemic. And as a result, we procured tablets. We have a school student population of 35,000 and 30,000 tablets were procured to assist students. But we also have the challenge in terms of improving our limitations with ensuring that even though there is a universal education, there is quality education. Because we saw the shortfalls of having blended learning approaches, where those who are slower learners could easily be left behind. New programs were introduced to support strengthening slow learners and also strengthening persons or students with behavioral challenges. When it comes to women and addressing additional burden of unpaid domestic work or withdrawal from the labor market and exposure to violence in the home, we also introduced grants to support female-headed households where their children of school age were directly and indirectly affected due to the blended learning environments. So in providing grants of that nature, because of our national shock responsive social protection strategy, families were able to be provided additional support. Now, what that does too is that it opens opens the nation to the challenges of addressing the needs of the household when the parents are, especially in the case of female-headed households, are totally exposed to becoming teachers of their children at home and still providing the domestic primary care that is required, and especially where there are literacy limitations for those households. How do we help them? What we also introduce is not just about cash transfer, but how do we ensure that there is quality development to the cash transfer that is actually provided? We introduce life skills development programs, and we also introduced agriculture as a vehicle out of poverty by looking at a food security initiative and introducing farm skills internship programs. With regards to economy and employment, we looked also at the youth population, where we introduced a prime program to assist in entrepreneurship development for young people. And of the youth population, we service 4.9% of the youth population, where we provide capital investment funds and other resources to ensure that if you are starting a new business or you are strengthening your existing business, that those are areas in which we strengthen the support that was necessary for small business development. So when it comes to the Montevideo consensus, as a matter of fact, before we go there, the pandemic was not the only thing that St. Vincent and the Grenadines had to address, because in 2021, we also experienced a volcanic eruption that caused approximately 18.1% of the population to have to evacuate their homes, live in a resettlement which is a temporary provision, shelters, both private and public shelters, over a duration of period in 2021 while we were handling the pandemic. So it also created similar impact as the pandemic did, and it affected every aspect that was highlighted here since yesterday to be known as the same repercussions of the pandemic as it were the volcanic eruption, because it represented another socioeconomic issue or challenge in the country. So when we add the impact of the pandemic to persons having to relocate due to the volcanic eruption, we now had to add an additional suite of social protection programs that we are actually implementing at this stage to help families with the same challenges: reduce poverty, reduce morbidity and the challenges with comorbidities, etc. Reduce also the psychosocial challenges that are associated with a volcanic eruption. They also had additional loss of learning because of the fact that we had to even ask our regional bodies who dealt with examinations for students to have additional periods of extension so that those children can have ample time to sit their exams. We also had increased challenges with regards to gender-based violence, also in terms of additional burden on female-headed households. And we had a major housing revolution project that came out of this, because we also had to look at the housing deficits that came out of the pandemic, plus the housing deficits that was affecting 18.1% of the population due to the volcanic eruption. It also causes us to look in the direction of what new initiatives, because the areas that were evacuated were primarily one of our great contributions to the GDP, fishing and farming. So as they were affected, it now causes us to look in the direction of economic employment opportunities and revitalizing those GDP contributors. So how does all of this fit back into the Montevideo? And the question that was raised by the chief of the statistics division with regards to the policy landscape. As one of the critical priority actions of the Montevideo consensus, the first one, which is the full integration of population dynamics. St. Vincent and the Grenadines looks at what we have as the National Economic and Social Development Plan. Goal 2 of that plan looks at enabling human and social development with 4 key objectives in that goal: social protection of the vulnerable, poverty reduction, youth development, gender equality. We recently concluded a national social protection policy framework that seeks to ensure that there is legislative development and harmonization, institutional strengthening, program development, and promoting social change. What is a direct need still is that we ensure that we have effective social protection data management and the need for information sharing policies, because we must be able to speak to each other in all the institutions where all the different administrative records exist, so that not only one fraction of the economy benefits, but we are able to decentralize the services and ensure effective rural development simultaneously. We also require still greater investment in quality education if we are to look at the rights, needs, responsibilities, and requirements of girls, boys, adolescents, and youth. Also, there are additional priorities required for aging, social protection, and socioeconomic challenges. We listened today to the next steps of 2022 to 2024 from the outlook that that was presented earlier this morning. And it included the implementation of the Madrid International Plan of Action and also the San Jose Charter of the Rights of Older Persons in Latin America and the Caribbean. St. Vincent and the Grenadines is also looking for that support in terms of that national policy framework on aging to support the drafting of Protection of Elderly Persons Bill, and also to reaffirm the San Jose Charter on the Rights of Older Persons, and as well as the Madrid, to support the articles of the Madrid International Plan of Action on Aging. Also, when it comes to gender equality, our priority at this time, we want to be able to focus on promoting gender role development and its impact on family life at the community levels. It is becoming a critical part of the social change experience and behavioral change that is required in our nation. Also, in order to ensure that we have a greater response mechanism for gender-based violence, we have to promote greater efficient policies and priorities that reduces the underreporting of gender-based violence in our rural districts. And it is critical that we have a national strategy that helps the national machinery to increase its efficiency and function. So without further ado, I would like to say on behalf of our country a heartfelt thank you to the conference for facilitating this suite of knowledge that was passed on today, especially from the panel of directors that were able to provide the landscape of opportunities as well as the programs that are actively implemented from the subsidiary bodies of ECLAC. Thank you.
Thank you very much to the delegation of St. Vincent and the Grenadines. Now we shall listen the delegate from Nicaragua. Thank you very much, Mr. Chair. Nicaragua, as of July 1st of 2021, published its fourth consecutive national plan called National Plan to Fight Poverty and for Human Development 2022-2026. That includes 6 chapters, of which now I would like to mention 2, which are related with what we've been discussing this afternoon. The first one are the 2 national guidelines and the chapter on implementation, follow-up, and assessment of the plan. Regarding the first one, the plan includes 7 guidelines for continuity purposes and 5 guidelines to work on subjects, to continue to work on some subjects, but that in the new national and international context have become a priority in the public policies of the country. Our national guidelines are aligned with the national priorities as well as with the 2030 agenda and other national instruments. These guidelines speak about the macroeconomic stability, but not as a purpose in itself, but rather as a means in order to guarantee the resources for the programs to fight poverty and for human development. This has to do with reinforcing the basic conditions for development, and I would like to mention security and peace. The country will continue to be the containment wall for drug trafficking and organized crime in this part of the Americas. We will develop our roads, energy, water, sanitation, telecommunications, logistic networks, And also, we have a guideline for development of human talent. So we will strengthen education at every level and every modality, from basic education, high school, technical and technological education, and university education. We will continue to consolidate the national system of education, research and innovation, and digitalization of the society. Regarding the consolidation of public goods and services of the country, we will continue to strengthen health networks and services, social security, comprehensive care to the families and disabled persons, labor rights, care for older persons, and promotion of sport. Regarding gender equality, we want to close the gender gap, which in this country, according to the World Economic Forum, by 2030 would be completely closed, this gap. The young people have been considered in our national plan to fight poverty as a central axis of the development. And there's a lot of work that we're carrying out to provide comprehensive care to the youth. More and better production. We will continue to advance in food security, in technologies, agricultural surveillance, the work on I take care of the oceans and marine resources, agro-industry associations, support services for production, and environmentally sustainable mining. In these first 7 guidelines, we guarantee a continuity of the public policies that have given excellent results in Nicaragua. The 8th guideline that I will mention now, these are subjects, as I said in the beginning, that have become the priorities of the public policy. First, to foster creative economy. The second one has to do with giving dynamism to trade and markets, and an important progress in the last months has been the reestablishment of relationships with the Popular Republic of China. We're also working on the guideline of building resilient and inclusive cities, and we will work strongly also in measurements of adaptation and mitigation given climate change and variability. And an axis that couldn't be left outside is the Caribbean coast of Nicaragua, understanding it as a special area for socioeconomic development. Regarding the second chapter that I mentioned, and that has to do with the implementation, follow-up, and assessment of the plan, we are making progress in the consolidation of the systems and entities that generate information in the national statistics system. We would like to reiterate the request we've made to ECLAC to work together in order to update the regional observatory for the development of Latin America and the Caribbean, especially the chapter on Nicaragua, that given our plan to fight poverty is not updated. Thank you, Mr. Chair, and greetings to all of you. We thank the intervention by the representative of Nicaragua, and we continue now with the representative of the political articulation of networks and organizations of Afro-descendant persons in Latin America and the Caribbean. Good afternoon to everyone. Thank you very much, Mr. Chair. I would like to thank the director of the Latin America and Caribbean Democracy, CELADE, for offering us this space. I won't speak very long, but I hope I will speak strongly regarding the political organization of the network of Afro-descendants in the framework of this conference. Well, the networks, collectives, organizations, and activists of Afro-descendant civil society of Latin America and the Caribbean gathered in Santiago, Chile, June 22, 2022, in the framework of the 4th Conference of Population and Development. We would like to say that we continue with our commitment with the Montevideo Consensus. We need to accelerate the commitment, or actually the compliance of the measures adopted to face the inequalities of the Afro-descendant populations. And we're also fighting for the recognition of our rights. Regarding the Montevideo Consensus, we need a recognition of the different measure and of our rights. We know the platform of the Conference on Population and Development and the Montevideo Consensus as an important tool to fight against a racist policy, structural racist policy that undermines the rights of the Afro-descendant persons, environmental and other. We express our concern regarding the structural inequalities that still exist regarding the Afro-descendant persons in Latin America and the Caribbean. And this affects very especially women, children, adolescents, young persons, and older persons, transgender persons, disabled, migrants, those that live in rural or coast areas or in the poorest and most marginalized areas. The COVID-19 pandemic has affected in a disproportionate way the inequalities of the Afro-descendant population of the region. Given that fact, we recommend the construction of affirmative public policies post-pandemic focused towards the economic and social recovery of these populations, and we need to include ethnical indicators in the consensus. We need to take into account the multiple human situations. We see that after 10 years of the Montevideo Consensus, well, we are concerned because the implementation of some measures some are lagging behind and not very much reported. Also, we call the attention on the precarious statistics, and we ask the states to include us in their vital statistics, to include data on population on the basis of ethnical and racial aspects. The Afro-descendant chapter has to be implemented soon, and we need to report on the advances, obstacles, and problems regarding the priorities in the voluntary national reports for the implementation in 2022. We recognize the important work of the Chilean people in the attainment of its recognition, and we hope they will participate fully in the constituent process. We greet Mrs. Marquez from the Republic of Colombia. We recognize the efforts of ECLAC and of the UNFPA, their efforts to show the reality of the Afro-descendant persons. But this is not enough. If we do not have a commitment from the states not to leave them behind, we, collectives, networks, organizations, and activists of the Afro-descendant civil society present in this 4th conference, thank the government of Chile, we thank ECLAC, and we thank the UNFPA for this 4th conference where we have become a forum for we have formed a forum for the follow-up of the Afro-descendant chapter in the Montevideo Consensus, and we need to be recognized to advance together with the states in the compliance of this chapter. We need an articulation of the networks and organizations in Latin America and the Caribbean. Thank you very much.
We thank the intervention. We have exhausted the list of requests, So we've reached the end of this day, and we've gone to the facts and interactions that we can request so as to have thematic links with other subsidiary bodies that will allow us to move forward in that with that approved and adopted in Montevideo 10 years back. And so tomorrow we resume at 10 o'clock. Good afternoon. Thank you very much.
Casi me quedo sin voz ahorita, me ha dado ganas de